കാത്തും പോലെ ഉൾത്തുമ്പിൽ തെളിയും കണികൾ നീ
Check. Hello. 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 Check. Hello. Hello. Check. Hello. 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 Check. Hello, check. Hello, hello, check. Hello, hello, check. Check. Hello, 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 check. Hello, hello, check. Hello, hello, check. Hello, 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 check. Hello, hello.
It's not like the good old days. Not like the good old days.
Not like the good old
Not like
days.
the good old days.
ആരോമൽ പൂവ് പോലെന്നിൽ പൂത്ത പെണ്ണെ പേരു ചൊല്ലുമോ ആരോരും കണ്ടിടാദൂരം ഇന്നു നീ എൻ കൂട്ടുപോരുമോ കുറുന്നു പൂങ്കവേ കുറുമ്പു പുഞ്ചിരി മുഖം തെളിഞ്ഞാൽ ഉദിക്കും കിനാവുകൾ നിറഞ്ഞു തൂവും ഇളം തേനിലാവാണിവൾ
തുള്ളിമാർക്കിടാവ് നെഞ്ചിലേറ്റിടും കുഞ്ഞു ചന്ദ്രബിംബമേ കണ്ണുഴിഞ്ഞുഴിഞ്ഞു നിന്നെ നോക്കവേ എന്തിതെന്തു ചന്തമേ
മേലെ മേഘപാളി താഴെ മഞ്ഞു തൂകി നിന്മൈ മൂടി നിൽക്കവേ നേരം നിന്നു പോയി ഏതോ മായ പോയി ഒന്നായി നാം നടക്കവേ നദിയിന്നോളങ്ങൾ കാണാത്ത കൊലുസുകളായി കാറ്റിൻ സാരംഗി മൂളുന്നു മധുരിതമായി നിനക്കു വേണ്ടി ഈ പ്രപഞ്ചമേ വിരിഞ്ഞു നിൽക്കയായി
തുള്ളിമാർക്കിടാവ് നെഞ്ചിലേറ്റിടും കുഞ്ഞു ചന്ദ്രബിംബമേ കണ്ണുഴിഞ്ഞുഴിഞ്ഞു നിന്നെ നോക്കവേ എന്തിതെന്തു ചന്തമേ
എന്നും ആത്മഭൂതമാം പ്രണാരവം.
വടപുഴിക്കങ്കമൊരുങ്ങുന്നേ നെഞ്ചിൽ തഞ്ചമൊരുങ്ങുന്നേ അവർ അഞ്ചാം കുന്ന് കയറുന്നേ പള്ളിക്കുന്നിലെ മുറ്റത്ത് വടപുഴിക്കങ്കമൊരുങ്ങുന്നേ കൊമ്പൻ തുമ്പി ചുഴറ്റുന്നേ കടുവ കണ്ണ് കലങ്ങുന്നേ പമ്പന്മാർ അവർ രണ്ടാളും നേരെ നേരെ പാഞ്ഞതടുക്കുന്നേ കൊമ്പൻ തുമ്പി ചുഴറ്റുന്നേ കടുവ കണ്ണു കലങ്ങുന്നേ പമ്പന്മാർ അവർ രണ്ടാളും നേരെ നേരെ പാഞ്ഞതടുക്കുന്നേ ആവോ ദാവാരോ മുണ്ടു മുറുക്കണല്ലോ ആവോ ദാവാരോ പമ്പ് പിടിക്കണല്ലോ ആവോ ദാവാരോ മണ്ണ് പറക്കണല്ലോ ആവോ ദാവാരോ വെള്ളിടി വട്ടുന്നല്ലോ എല്ലാരും ചൊല്ലണതല്ലിവൻ കച്ചുക്കുള്ളൊരു കാര്യക്കാരൻ മൊഞ്ചാണേ ലങ്കി മറിഞ്ഞൊരു മാനത്തമ്പിലി പോലൊരു മാനങ്കടലാണേ നീന്തി കയറിയ പോരിശയുള്ളൊരു ബാല്യക്കാരൻ നെഞ്ചാണേ ലഞ്ചി കൊഞ്ചണ കണ്ണഞ്ചും ഒരു ചെഞ്ചൊടിമാരൻ ഉണ്ടായി ഒരു ചെടിയുണ്ട് കാതിലു കടുക്കനും വേറുണ്ട് അതവിനും ഒരു ലേസുണ്ട് കനിയാണ് കച്ചില് വേറുണ്ട് മണിയറ തുറക്കണ ചിരിയുണ്ട് ചിരിയിൽ ചേല് പൊതിയുണ്ട് അരിമുല്ല കണക്കിന് കഥയുണ്ട് കഥയാണ് പറയാനേറുണ്ട്.
Look, who came with a lot of gold? Remember when you wanted this naivety was all you own? I stole and got you were like, man, what you own? Now you're like, talk about the drugs I gave your dad a dose. They be destroying these women left, right, and center. Maybe this time it'll be fighting curtains or just winter. Babies with odd names, father or family roots. Harder it gets for them, average is set for them high. You keep walking back as I cover you. Had to come back from behind and say you covered me. Hover you, coming back from all the mess like you know nothing has bothered you. Where did you get all the collar and the Nike who powered you? Products all around, but poverty and real. Tap it even till make it look like monetary deals. Daffodils the killer, you said you'd have put him in the face. You murderer, seems like you lost the people who you could have called a murderer. Now you would go to door.
ഉണ്ടായി ഒരു ചെടിയുണ്ട് കാതിലു കടുക്കനും വേറുണ്ട് അതവിനും ഒരു ലേസുണ്ട് കനിയാണ് കച്ചില് വേറുണ്ട് മണിയറ തുറക്കണ ചിരിയുണ്ട് ചിരിയിൽ ചേല് പൊതിഞ്ഞുണ്ട് അരിമുല്ല കണക്കിന് കഥയുണ്ട് കഥയാണ് പറയാനേറുണ്ട്. എല്ലാരും ചൊല്ലണതല്ലിവൻ കച്ചുക്കുള്ളൊരു കാര്യക്കാരൻ മൊഞ്ചാണേ ലങ്കി മറിഞ്ഞൊരു മാനത്തമ്പിലി പോലൊരു മാനങ്കടലാണേ നീന്തി കയറിയ പോരിശയുള്ളൊരു ബാല്യക്കാരൻ നെഞ്ചാണേ ലഞ്ചി കൊഞ്ചണ കണ്ണഞ്ചും ഒരു ചെഞ്ചൊടിമാരൻ.
Hello, hello. Good evening, friends. We will be starting the program very shortly within the next 5 to 10 minutes. I request all the people who are standing on the sides to please come forward and please be seated. We'll start the program within the next 5 to 10 minutes. Thank you.
ഉണ്ടായി ഒരു ചെടിയുണ്ട് കാതിലു കടുക്കനും വേറുണ്ട് അതവിനും ഒരു ലേസുണ്ട്
sa ga sa ni sa ga ga sa la 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 ba 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 ta ra 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 la 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 la
ദേവദൂതർ പാടി സ്നേഹദൂതർ പാടി ഈയൊലിവിൻ പൂക്കൾ ചൂടിയാടും നിലാവിൽ. ദേവദൂതർ പാടി സ്നേഹദൂതർ പാടി ഈയൊലിവിൻ പൂക്കൾ ചൂടിയാടും നിലാവിൽ. ഇന്നു നിന്റെ പാട്ടു തേടി കൂട്ടുതേടിയാരോ വന്നു നിന്റെ വീണയിൽ നീ പാണികളിൽ തൊട്ടു.
ni sa ga sa ni sa ga ga sa ni sa ga sa ni sa ga ga sa
ഇന്നു നിന്റെ പാട്ടു തേടി കൂട്ടുതേടിയാരോ വന്നു നിന്റെ പാടി വരാം ആദിയാരെ ചൊല്ലി.
ദേവദൂത പാടി സ്നേഹദൂത പാടി ഈയൊലിവിൻ പൂക്കൾ ചൂടിയാടും നിലാവിൽ ആയിരം വർണ്ണങ്ങൾ കൂടെ വന്നു അഴകാർന്നൊരാടകൾ നെയ്തു തന്നു
ആയിരം വർണ്ണങ്ങൾ കൂടി വന്നു അഴകാർന്നൊരാടകൾ നെയ്തു തന്നു.
ആമാടപ്പെട്ടി തുറന്നു തന്നു ആകാശം പൂത്തു
ഭൂമിയിൽ കല്യാണം സ്വർഗ്ഗത്തും കല്യാണം ഭൂമിയിൽ കല്യാണം സ്വർഗ്ഗത്തും കല്യാണം ഭൂമിയിൽ കല്യാണം സ്വർഗ്ഗത്തും കല്യാണം.
They say the key to success is committing to one thing.
ഇവാനിൻ തീരങ്ങൾ തെളിയുന്നു കാണാത്ത ലോകം നാം അണയുന്നു ആഴങ്ങൾ തീരാതി കടൽ പോലെ കഥകൾ നീളുന്നു ഇവിടെ ആരാരും.
Good evening all. I request the people who are standing to please come and be seated. Let's start the program. Once again, good evening all. We all know that the health is wealth. Across the way, the incidence of cancer is increasing rapidly. Therefore, it is important to set up cancer literacy and the knowledge among the population. Sohar in association with Badar Hospital Sohar is conducting first ever awareness campaign on cancer and life CPR demonstration today, along with free medical screening camp. As a committed social organization, Sohar has always made it a point to conduct such social welfare programs for the well-being of all communities in Sohar. In this month's program, we are glad to have the best expert professionals from this field. In this month's program, we are glad to have the more expert professionals from this field. Dr. Badar himself, leading clinical radiologist and oncologist, and Dr. J. Badar, leading consultant cardiologist, who will be sharing us with the information about the topics and will be clearing all of doubts. We hope that this session will help us to take prevention by making necessary changes in the life. Now, I welcome Mr. Badar, Secretary of Sohar to have a welcome speech.
Thank you, Jabbar. Good evening, all. I am truly privileged to stand here in front of you to present the welcome note for this medical awareness program being conducted by Sohar Malayali Sangam in association with Badar Samaa Hospital and Lulu Hypermarket. Before I return my duty, I would like to say a few words about Sohar Malayali Sangam. I know, you don't need an introduction to Sohar Malayali Sangam, as everybody knows. We always committed to social commitment, and we always conduct such activities in our past. Of course, last 2 years we could not conduct any major events because of the pandemic, as you all know. Otherwise, we used to conduct youth festival and carol every year. Youth festival, you all know that it is one of its competitions which is being well known all over for its professional organization and impartial judgment. And carol is one of the mega events which is normally attended more than 10,000 attendees. And many other social activities used to conduct. And this is one of its kind. It's very unique. As Jaden said, it's a health is wealth, we all know. But we need to have more focus on our health. So that is the reason we are conducting this program today. And this is our humble start for 2023. Now, coming back to my responsibility, I would like to welcome Dr. Boss Vincent, leading oncologist Badar Samaa. I cordially welcome you, sir, for this program. I am sure that you can give us share a lot of knowledge, and it will be helpful all of us. And I would like to welcome Dr. Prabhakar. He is a cardiologist, Badar Samaa. He will also going to present a live CPR presentation, which is going to help us a lot. Maybe we can save the life of someone. That is a very important thing. Every individual should know about the CPR because anything can happen anytime. So that is the reason. So CPR is very important nowadays. So he is going to give us a live demonstration. So I welcome you, sir. I would like to welcome Rashid Bhai, Deputy DM, Lulu Hypermarket. I would like to welcome Manoj sir. Manoj is manager of Badar Samaa and is our president too. And I cordially welcome
Now, I welcome Mr. Manoj Kumar, President Sohar Malayali Sangam and Manager of the Samaa Hospital Sohar, to deliver a few words.
Respected Dr. Bose Vincent, who has come all the way from Muscat, and my dear brother and honorable chairman of Indian Social Club, President Mr. Rajesh Kondana, and Dr. Prabhakar, Mr. Ravi, and dear Madaji, and all dear, and Mr. Ashik, Deputy GM Lulu, and my dear brothers and sisters, and all entire whoever is present here, very, very good evening, wonderful. Today we know that on the occasion of our Republic Day and the social commitment towards the society of Sohar Malayali Sangam, we are conducting this program. And a warm welcome to Panangal for this auspicious and productive evening. Today is all about, we know, the saving lives and how we can upbring ourselves to a point where we can save the life when somebody around us, when we are helpless, somebody around us is gasping for the lives. And today we have two sessions. First session is by Dr. Bose Vincent, who is our clinical and radiology oncologist, who has come from India. Now, Doctor is going to be, according to, as well, because of our request, he has agreed to be the part of Badar Hospital. And our entire, all the across Oman, all the 13 branches, we are going to start Carcinoma Cancer Early Detection Center. That, since our program is here, tomorrow Badar Hospital is going to launch our detection program tomorrow itself. We all know about cancer that it is a second most killing disease in the world. And can it be prevented? Can it be diagnosed early? What is the prognosis? And can it be treated? We know that some of the cancers can be treated fully. And each and every information will be delivered here. The session will be done by Dr. Bose, who is very expert in this area. And our next program will be by Dr. Prabhakar. We know that in social media, and we have seen, and the real cases, last 2 months we have seen in the volleyball court, we have seen in the video that one person has lost life because of the unawareness of the CPR, cardiopulmonary resuscitation. And that live demonstration will be here by Dr. Senior Cardiologist Dr. Prabhakar and our Badar team. And whoever is having any doubt, any concerns, any information need, you can ask anything about these both the cases. You please make use of this evening, and I wish you a very good evening, everyone, and thank you very much. Thank you.
Now, let me invite Mr. Rajesh Kondana, President Indian Social Club Sohar, to give a presentation. Stop, please.
Good evening, ladies and gentlemen. Thank you very much for calling us here. This is awareness for cancer, and last few months, so many people have died due to cancer. So I feel my responsibility to be here and to be part of this. And I congratulate Badar Samaa and Malayali Sangam of Sohar and Lulu for giving this opportunity to us. And the doctor all the way come from India, and we want your support
Now, before starting the session, I request all of you to maximum utilize this opportunity to grab the things and clear whatever doubts you have. Let's welcome Dr. Boyce Wilson, leading clinical radiologist and oncologist, for a talk on oncology. So please.
Hello. ഹലോ കേൾക്കാമോ? കേൾക്കാമോ? Yes. So very respected President and Secretary of Sohar Malayali Sangham, respected dignitaries on the front row, my very respected cardiologist service available here, and thank you everybody for joining today on this auspicious occasion. So, like, it's a festival season, but we are talking on a very difficult topic, or like about a scary topic, cancer. Probably when you heard cancer itself, you will be feeling scary. So how to change this scariness? Can we prevent cancer? Can we early detect cancer? Can we treat cancer completely? Can we cure cancer? You may have a lot of doubts regarding this. So probably next 30 to 35 minutes, we can discuss on few topics on cancer. Probably we can take few questions from you also. Okay? So which language will you prefer? Malayalam or English? Which you want? I heard it's a Sohar Malayali Sangham, so I thought I can talk in Malayalam. So which one is preferable? Okay, so we go by Manglish probably. Okay? Yeah, that's good. Yeah. So I represent an organization known as Karkinos Healthcare, which is a new organization in India, which is started with the help of Tata. So, and it is supported by many industry leaders like Mayo Clinic in USA, Harvard University in USA, and Tata Memorial Hospital, Reliance, Rakuten Medical, and many others. So our aim is to democratize the oncology treatment, because oncology treatment is the most difficult part of treatment in the healthcare nowadays. So democratize this treatment is a major aim of Karkinos Healthcare, and cancer awareness sections and early detection of cancers is one of the major focus which Karkinos is doing. So we have a lot of clinics and lot of hospitals available in India, and for the first time as an international basis, we have hold our hands with Badar Samaa group of hospitals. Still it's not good. So first time in Oman, we are hand-holding with Badar Samaa group of hospitals, and we are starting our work here in Oman. So for the next 30 to 35 minutes, we'll just look at this part. So this is the statistics from the world. Okay, there are more than 20 million new cancer cases are diagnosed in the world every year. 2 കോടിയിലധികം പുതിയ ക്യാൻസർ കേസുകളാണ് ഓരോ വർഷവും ലോകത്ത് കണ്ടുപിടിക്കുന്നത്. These are the most common cancers we see in the world. In the last you can see, in the both sexes, including men and women together, the most common cancer is breast cancer. Probably you all know. Followed by lung cancer, colorectal cancer. That means the large intestine, rectal area, vankudalum അതുപോലെ മലദ്വാരത്തിലൊക്കെ വരുന്ന ക്യാൻസറാണ് colorectal cancers. That's the third most common. Followed by prostate cancer and stomach cancer. If you see some females alone, സ്ത്രീകളിൽ മാത്രം നോക്കുകയാണെങ്കിൽ breast cancer is the most common, followed by colorectal cancer, lung cancer, cervix uteri. ഗർഭാശയത്തിൻ്റെ ഏറ്റവും താഴെ ഭാഗത്തെയാണ് സർവിക്സ് എന്ന് പറയുന്നത്. സർവൈക്കൽ ക്യാൻസർ ആണ് ഫോർത്ത് മോസ്റ്റ് കോമൺ ഇൻ ദ വേൾഡ്, ഫോളോ ബൈ തൈറോയിഡ് ക്യാൻസർ. പുരുഷന്മാരിൽ നോക്കുകയാണെങ്കിൽ ലങ് ക്യാൻസർ, പ്രോസ്റ്റേറ്റ്, കോളോറക്ടൽ, സ്റ്റൊമക് ആൻഡ് ലിവർ. ദിസ് ഇസ് ദ സ്റ്റാറ്റിസ്റ്റിക്സ് ഫ്രം ഒമാൻ. ഒമാൻ്റെ സ്റ്റാറ്റിസ്റ്റിക്സ് പറയുന്നത് there are more than 3,700 new cancer cases diagnosed in 2020. These are the registered cases. There will be a lot of unregistered cases also. The most common again is breast cancer, followed by colorectal, lymphomas, stomach. ഇതൊക്കെയാണ് നെക്സ്റ്റ് വരുന്ന ക്യാൻസറുകൾ എന്ന് പറയുന്നത്. Look at the statistics from India. There are more than 13 lakh or 1.3 million new cancer cases. ഇത് ഞാൻ പറയുന്നത് ടോട്ടൽ കേസുകളുടെ എണ്ണമല്ല, പുതുതായി കണ്ടുപിടിക്കുന്ന കേസുകളിലാണ്. കഴിഞ്ഞ വർഷം കണ്ടുപിടിച്ച കേസുകൾ ഇവിടെയുണ്ട്. അതല്ലാതെ ഒരു വർഷം പുതുതായി കണ്ടുപിടിക്കുന്ന ക്യാൻസറുകൾ എന്ന് പറയുന്നത് 13.4 ലക്ഷത്തിൽ അധികം ക്യാൻസറുകളാണ് ഇന്ത്യയിൽ മാത്രം എവറി ഇയർ കണ്ടുപിടിച്ചുകൊണ്ടിരിക്കുന്നത്. അഗെയിൻ the same only, the most common cancer in males and females is breast cancer, followed by lip and oral cavity cancer, cervix uteri, cervical cancer, lung cancer and colorectal cancer. ഇതൊക്കെയാണ് മോസ്റ്റ് കോമൺ ക്യാൻസേഴ്സ്. യു ക്യാൻ സീ എ നമ്പർ കോൾഡ് 10.4 ഹിയർ. വാട്ട് ഈസ് ഇറ്റ്? ദ റിസ്ക് ഓഫ് ഡെവലപ്പിംഗ് ക്യാൻസർ ബിഫോർ ദ ഏജ് ഓഫ് 75 ഈസ് 10.4%. ദാറ്റ് മീൻസ് അതിൻ്റെ അർത്ഥം എന്ന് പറയുന്നത് 100 പേരിൽ 10.4 ആളുകൾക്ക് അല്ലെങ്കിൽ 10 പേരിൽ ഒരാൾക്ക് ക്യാൻസർ വരുന്നതിനുള്ള സാധ്യത ഉണ്ട്. ഇപ്പം എന്നെ ഇവിടെ കേൾക്കുന്നത് ഒരു 100 പേരുണ്ട് എന്നുണ്ടെങ്കിൽ ഇതിൽ 10 പേർക്ക് ക്യാൻസർ ജീവിതകാലത്തിൽ വരുന്നതിനുള്ള സാധ്യത ഉണ്ട്. ഈ ഒരു കാലഘട്ടത്തിലാണ് നാം ജീവിക്കുന്നത്. ഒരു 10-20 വർഷം മുമ്പ് ക്യാൻസർ വാസ് സംബഡീസ് ഡിസീസ്. ആരുടെയോ ഒരാൾക്കൊക്കെ വരുന്ന അസുഖമായിരുന്നു. ഇന്ന് നമ്മുടെ എല്ലാവരുടെയും ഫാമിലിയിൽ ഒരാൾക്കോ റിലേറ്റീവിൽ ഒരാൾക്കോ നമ്മുടെ സുഹൃത്തുക്കളിൽ ഒരാൾക്കോ ക്യാൻസർ വന്ന ഒരു സാഹചര്യത്തിലാണ് നാം നിൽക്കുന്നത്. എങ്ങനെയാണ് ഇതിൽ നിന്ന് ഒരു മാറ്റം വരുത്തുക എന്നാണ് നാം നോക്കുന്നത്. ഇന്ത്യൻ സ്റ്റാറ്റിസ്റ്റിക്സ് നാം പറയുമ്പോൾ 1.32 million ന്യൂ ക്യാൻസർ കേസ് ആർ ഗെറ്റിംഗ് ഡയഗ്നോസ്ഡ് എവറി ഇയർ. 1 in 10 of us will develop cancer. പക്ഷേ ഇതിനേക്കാളെല്ലാം കൂടുതലായി നമ്മളെ പേടിപ്പെടുത്തുന്ന വിഷയം എന്തെന്ന് വെച്ചാൽ the 5-year survival rate in India is less than 30% than compared to Western countries. അതായത് ക്യാൻസർ വന്ന ഒരു വ്യക്തി 5 വർഷം വരെ ജീവിച്ചിരിക്കാനുള്ള സാധ്യത വെസ്റ്റേൺ കൺട്രീസുമായി താരതമ്യം ചെയ്യുമ്പോൾ ഇന്ത്യ പോലെയുള്ള രാജ്യങ്ങളിൽ 30% താഴെയാണ്. അവർ 70% അവരുടെ സർവൈവൽ റേറ്റ് എന്നുണ്ടെങ്കിൽ നമ്മുടെ അവിടെ അത് 40% അതിൽ താഴെയോ ആണ്. ഇതാണ് എന്തുകൊണ്ടാണ് നമ്മുടെ നാട്ടിൽ മാത്രം വൈ ദിസ് കൈൻഡ് ഓഫ് എ ഡിഫറൻസ് ഇൻ സർവൈവൽ റേറ്റ് ഇസ് ദർ എന്നതാണ് നമ്മളെ ഏറ്റവും കൂടുതൽ പേടിപ്പെടുത്തുന്ന വിഷയം എന്ന് പറയുന്നത്. എന്തൊക്കെ നമുക്ക് അതിനു വേണ്ടി കാര്യങ്ങൾ ചെയ്യാൻ പറ്റും എന്ന് നോക്കാം. ഇവിടെയാണ് ഏർലി ഡിറ്റക്ഷൻ ഓഫ് ക്യാൻസേഴ്സ് എന്നതിൻ്റെ ഇമ്പോർട്ടൻസ് പറയുന്നത്. 70 to 80% of cancers are diagnosed late nowadays. Only 20 to 25% of them are diagnosed earlier. And most of the cancers are completely curable if diagnosed early. നേരത്തെ കണ്ടുപിടിക്കുന്നു എന്നുണ്ടെങ്കിൽ ഒരുവിധം എല്ലാ ക്യാൻസറും തന്നെ പൂർണ്ണമായി ചികിത്സിച്ച് സുഖപ്പെടുത്താൻ സാധിക്കുന്ന ക്യാൻസറുകളാണ്. സോ വാട്ട് ഈസ് ക്യാൻസർ? എന്താണ് ക്യാൻസർ എന്ന് പറയുന്നത്? നിങ്ങൾക്ക് ആർക്കെങ്കിലും ഒന്ന് വോളണ്ടർ ചെയ്യാൻ പറ്റുമോ? എന്താണ് ക്യാൻസർ? മാഡം തന്നെ ആയിക്കോളൂ. എന്താണ് ക്യാൻസർ? എന്താ? ഇല്ല ജസ്റ്റ് എന്തെങ്കിലും ഒരു വളരെ ബേസിക് ആയിട്ട് പറഞ്ഞാൽ മതി. വളരെ ശരിയാണ്. ഏറ്റവും സിമ്പിളായി പറഞ്ഞു കഴിഞ്ഞാൽ It's the, usually cells divide according to the needs of the body. For some reason, cells start dividing uncontrollably and invaded nearby tissues. അതായത് വളരെ നിയന്ത്രിതമായിട്ട് നമ്മുടെ ശരീരത്തിൽ സെല്ലുകൾ ഇങ്ങനെ വളർന്നുകൊണ്ടിരിക്കുകയാണ്. ചില കാരണങ്ങൾ മൂലം ഇത് അനിയന്ത്രിതമായിട്ട് വളരാനായിട്ട് ആരംഭിക്കും. അതിനെയാണ് നമ്മൾ ക്യാൻസർ എന്ന് വിളിക്കുന്നത്. ചില കാരണങ്ങൾ മൂലം അനിയന്ത്രിതമായി ആദ്യം വളരാൻ ആരംഭിക്കും. രണ്ടാമത് ഇത് അടുത്തുള്ള സ്ട്രക്ചറിലേക്ക് ഇറ്റ് വിൽ ഇൻവേഡ് ദ നിയർബൈ സ്ട്രക്ചേഴ്സ് ഓഫ് ദ ബോഡി. തേർഡായിട്ട് some of these cells will just shed into the bloodstream. They will move through the bloodstream and start colony in some other places. For example, ബ്രസ്റ്റിലാണ് ഇത് തുടങ്ങിയതെന്നുണ്ടെങ്കിൽ ബ്രസ്റ്റിൽ നിന്ന് ചില സെല്ലുകൾ പതുക്കെ ബ്ലഡിലേക്ക് ഇറങ്ങും. ബ്ലഡിലൂടെ ഇത് സഞ്ചരിക്കും, മറ്റൊരു സ്ഥലത്തെത്തും. പ്രോബ്ലി ലിവറിലെത്താം, അല്ലെങ്കിൽ ബ്രെയിനിലെത്താം. അവിടെ പോയി പുതിയൊരു കോളനി സ്ഥാപിക്കും. അപ്പോൾ നമ്മൾ സ്റ്റേജ് 4 ക്യാൻസറായി അല്ലെങ്കിൽ മെറ്റസ്റ്റാസിസ് ചെയ്തു, ഇനി ബുദ്ധിമുട്ടാണ് എന്നൊക്കെ പറയുന്ന ഒരു സ്റ്റേജിലേക്ക് ഇതെത്തും. ഇതിനെയാണ് വളരെ സിമ്പിളായിട്ട് ക്യാൻസർ എന്ന് പറയുന്നത്. ഞാൻ നിങ്ങളോട് പറഞ്ഞു, ചില കാരണങ്ങളാൽ ക്യാൻസറുകൾ അനിയന്ത്രിതമായി പെരുകുന്നു. എന്തൊക്കെയാണ് ഈ സാധാരണ ചില കാരണങ്ങൾ എന്ന് പറയുന്നത്? സോ ഇതൊക്കെയാണ് സാധാരണയായി കാണുന്ന കാരണങ്ങൾ. 30% ക്യാൻസറുകൾ കാരണം 30% of the cancers is caused by tobacco. It can be smoking or any kind of a smokeless tobacco. 30% of the cancers is caused by tobacco. 25% of the cancer is caused by our diet and lack of physical exercise. നല്ലതല്ലാത്ത ആഹാര രീതിയും അതുപോലെ തന്നെ ജീവിതക്രമവുമാണ് 25% ക്യാൻസറുകളുടെ കാരണം. 16 to 18% of cancers is caused by some kind of infections. ചില ഇൻഫെക്ഷനുകളാണ് 16-17% ക്യാൻസറുകളുടെ കാരണം. ഇൻഫെക്ഷനിൽ ക്യാൻസർ ഉണ്ടാക്കുമോ എന്ന് നിങ്ങൾ പക്ഷേ ഉണ്ടാകും. ഇന്ത്യയിൽ സെക്കൻഡ് മോസ്റ്റ് കോമൺ ആയിട്ടുള്ള സർവൈക്കൽ ക്യാൻസർ, സ്ത്രീകളിൽ കാണുന്ന സർവൈക്കൽ ക്യാൻസർ ഉണ്ടാക്കുന്നത് ഒരു വൈറസാണ്. വൈറസിൻ്റെ പേര് ഹ്യൂമൻ പാപ്പിലോമ വൈറസ്. ഈ വൈറസാണ് ഇന്നും സെക്കൻഡ് മോസ്റ്റ് കോമൺ ആയിട്ടുള്ള സർവൈക്കൽ ക്യാൻസർ ഉണ്ടാക്കുന്നത്. സ്റ്റൊമക്കിൽ വരുന്ന ചില ക്യാൻസറുകൾ ഉണ്ടാക്കുന്ന ഒരു ബാക്ടീരിയയാണ്. ബാക്ടീരിയയുടെ പേര് ഹീലിക്കോബാക്ടർ പൈലോറി എന്നാണ് ആ ബാക്ടീരിയയുടെ പേര്. ഇത്തരത്തിലുള്ള ചില വൈറസുകളും ബാക്ടീരിയകളുമാണ് 16 to 18% ഓഫ് ദ ക്യാൻസറിൻ്റെ കാരണം. 4% ക്യാൻസറിൻ്റെ കാരണം ആൽക്കഹോളാണ്. 8 ഡിഫറെൻറ്റ് ക്യാൻസറുകൾ ആൽക്കഹോൾ ഉണ്ടാക്കുന്നു. ലിവർ ക്യാൻസർ, സ്റ്റൊമക് ക്യാൻസർ, ഗോൾ ബ്ലാഡർ ക്യാൻസർ, പാൻക്രാറ്റിക് ക്യാൻസർ തുടങ്ങി 8 ഡിഫറെൻറ്റ് ക്യാൻസറുകൾ മദ്യപാനത്തിൻ്റെ മൂലം ഉണ്ടാകുന്നു. 2 to 4% of cancer is caused by some kind of occupational exposures and 2 to 4% is caused by pollution. So നമ്മൾ ക്യാൻസറിൻ്റെ റിസ്ക് ഫാക്ടർ, ക്യാൻസറിൻ്റെ മാത്രമല്ല മോഡേൺ മെഡിസിനിൽ എല്ലാ ജീവിതശൈലി രോഗങ്ങളുടെ റിസ്ക് ഫാക്ടേഴ്സിനെ കുറിച്ച് പറയുമ്പോഴും നമ്മൾ അതിനെ മോഡിഫയബിൾ റിസ്ക് ഫാക്ടേഴ്സിനും നോൺ മോഡിഫയബിൾ റിസ്ക് ഫാക്ടേഴ്സ് എന്നും പറയും. നമുക്ക് ഇന്ന കാരണം കൊണ്ട് ക്യാൻസർ വന്നു എന്ന് എല്ലാ സമയത്തും പറയാനായി സാധിക്കില്ല. മറ്റെല്ലാ ജീവിതശൈലി രോഗങ്ങളും, ഡയബറ്റീസിൻ്റെ കാര്യമായാലും ഹൈപ്പർ ടെൻഷൻ്റെ കാര്യമായാലും കാർഡിയക് ഡിസീസിൻ്റെ, സാഗ് നമ്മോടൊപ്പം ഉണ്ട്, കാർഡിയക് ഡിസീസിൻ്റെ കാര്യമായാലും ഇതുപോലെ തന്നെയാണ്. നമ്മളതിനെ റിസ്ക് ഫാക്ടറുകൾ എന്നാണ് പറയുന്നത്. റിസ്ക് ഫാക്ടറിനെ കുറിച്ചുമ്പോൾ നമുക്ക് അതിനെ രണ്ടായി ഡിവൈഡ് ചെയ്യാം. വി ക്യാൻ ഡിവൈഡ് ദം ഇൻടു മോഡിഫയബിൾ വൺസ്. Okay. Yeah. So we can divide them into modifiable risk factors and non-modifiable risk factors. But the good news is 90% of them are modifiable risk factors. That means we can do something about it. It's only 5 to 10% of them are non-modifiable, that we cannot do anything about it. Okay, so what are the ones we can do something about? What are modifiable ones? The most important, I have already told you, physical activity, dietary factors, obesity, these are the most important ones. Second part is alcohol use, tobacco use, excessive use of some kind of hormones, lack of breastfeeding. The more breastfeeding, there is a protective effect on breast cancer. So there is lack of breastfeeding, there is a chance that the woman will develop breast cancer. Some kind of environmental pollution, occupational like carcinogens, radiation, these all are modifiable part. And we have 10% of non-modifiable part. First one is gender and age. Like example, female gender have a more prone to develop breast cancer. We can't do anything about it. It's not in our hands. As the age advances, the chance of developing cancer increases. we can't do anything about it. All of us will age at one day. Personal history of cancer, family history of cancer. If mother have one particular cancer, there's a chance that a daughter also will develop that cancer. It's not always. 10% of the time the cancer goes in the family. So family history of cancer, some kind of menstrual irregularities, early menarche, late menopause, these all have a chance to develop breast cancer. Some kind of genetic cancer, but these all are non-modifiable and it's only 5 to 10%. Let's concentrate on the modifiable ones, which is around 90%. So cancer is scary. Can I do something about it? Yes, we can. We'll see what can be done. Can I prevent cancer? Yeah, we'll discuss. So what is prevention? Prevention in a modern medicine sees not as a single word. It comes under different headlines, not only in cancer, in all diseases. So first prevention is known as primary prevention. Primary prevention means you have a particular risk factor which causes a disease. So removing the risk factor which causes the disease so that you will not develop that disease. That is the part of primary prevention. For example, 90% of the lung cancer is caused by tobacco. Tobacco causes lung cancer. Don't use tobacco. You will not develop lung cancer. So that's a primary prevention. Very easy method. Lung cancer is caused by tobacco. Don't use tobacco. You had 90% chance you don't develop cancer. So remove all the risk factors which I have already told you. Alcohol, tobacco, good diet, physical activity. You have a chance that you will not develop cancer. That's a part of primary prevention. Second part is vaccination. I told you some of the cancers are caused by infections, especially cervical cancer, which is caused by human papilloma virus. There's a vaccine available now. It's available for the last few years, which can act against this HPV infection and will not develop cervical cancer in future. So this had to be given to girls before the age of 9 to 15, between the age of 9 to 15. You can give it up to the age of 26, not after 26. You have to give it before the marriage or like before starting the sexual life. You have to give it to the girls. So the best time is between the age of 9 to 15. There are two doses of vaccine that have to be given. So vaccine is available. This is also a part of primary prevention. But primary prevention is not always applicable in the case of cancer. Few of the cancers may not be able to do primary prevention, especially breast cancer. So there we have to do secondary prevention. Secondary prevention is screening and early diagnosis. That means we have to screen the disease. We have to find it out in a very early stage, cure it, treat it properly and cure it completely. That's a part of secondary prevention. It's a part of prevention. So that is the importance of screening and early diagnosis of cancers come up. I can tell you an example. For a breast cancer, if it is diagnosed at stage 1, the 10-year survival rate is around 97%. അതായത് സ്റ്റേജ് 1 ബ്രസ്റ്റ് ക്യാൻസർ കണ്ടുപിടിച്ചാൽ അദ്ദേഹം 10 വർഷം ജീവിച്ചിരിക്കാനുള്ള സാധ്യത 97%. സ്റ്റേജ് 4 ബ്രസ്റ്റ് ക്യാൻസർ കണ്ടുപിടിച്ചാൽ ദ 5-year സർവൈവൽ റേറ്റ് ഈസ് 22%. സ്റ്റേജ് 4-ലാണ് ബ്രസ്റ്റ് ക്യാൻസർ കണ്ടുപിടിക്കുന്നതെന്നുണ്ടെങ്കിൽ 5 വർഷം ജീവിച്ചിരിക്കാനുള്ള സാധ്യത 22%. നമ്മൾ സ്റ്റേജ് 1-ൽ ബ്രസ്റ്റ് ക്യാൻസർ കണ്ടുപിടിച്ചാൽ മതി, കാര്യം കഴിഞ്ഞു. സോ എങ്ങനെയാണ് കണ്ടുപിടിക്കുന്നതിനെ കുറിച്ച് നമുക്ക് തുടർന്നുള്ള സ്ലൈഡുകളിൽ ചിന്തിക്കാം. ദാറ്റ്സ് ദ ഇമ്പോർട്ടൻസ് ഓഫ് secondary prevention. Screening and early diagnosis as equivalent as preventing you from the cancer. So that's the importance of early diagnosis and screening. And third part is tertiary prevention. That is like in a advanced level, when we treat the disease, that comes a tertiary prevention. We'll be concentrating on primary prevention and secondary prevention. So what are the primary prevention methods? First, I told you tobacco. So tobacco causes more than 20 types of cancers. From all, you can see in this side of the body, starting from the lip to oral cavity to mouth to tongue to lungs to bladder to stomach to rectum to anywhere in the body. More than 20 types of cancers is caused by tobacco. 1/3 of the cancers, 30% of the cancers is caused by tobacco. So, ഒരു tobacco സെഷനെ കുറിച്ച് ഒരു വാക്ക് പറയാതെ ഒരു ക്യാൻസർ അവയർനെസ് ടോക്ക് എനിക്കിവിടെ ചെയ്യാനായിട്ട് പറ്റില്ല. സോ If anybody is using tobacco in this audience, I would request you to stop it today. Anybody is not using tobacco here, I would request you not to start using tobacco. So this is the only advice I would tell you. I would like you to choose life and not tobacco. Okay. So with this point, I am just moving forward. So second part is diet and regular exercise. Cancer is a lifestyle disease. Just like diabetes, hypertension, cardiac disease, cancer is a lifestyle disease. So this should be a good dietary pattern for anybody. It's not only for cancer, it's a good dietary pattern. At least half of our food plate should be filled with vegetables and fruits. 50% of the food plate. 1/4 of it, 25% can be our main food. It can be rice or chapati or bread or whatever it is. It should be 25%. And another 25% should be proteins. It can be meat or fish or eggs. It should be another 25%. So having a good diet along with exercise, we suggest at least 30 minutes a day into 5 days per week. അതായത് ഒരു ആഴ്ചയിൽ അറ്റ്ലീസ്റ്റ് 2.5 മണിക്കൂറെങ്കിലും ഒരു എയറോബിക് എക്സസൈസ് ചെയ്യുക, പ്ലസ് ഒരു നല്ല ഭക്ഷണശീലം സ്വായത്തമാക്കുക. ഇതിലൂടെ ഒരു പരിധി വരെയുള്ള ക്യാൻസറുകളെ നമുക്ക് പ്രിവെൻറ്റ് ചെയ്യാനായിട്ട് സാധിക്കും. സോ next we go to early detection and screening. Screening helps to detect cancer before the symptoms show up. ക്യാൻസറിനെ കുറിച്ചുള്ള ഒരു പ്രോബ്ലം എന്തെന്ന് വെച്ചാൽ പലപ്പോഴും ക്യാൻസറിൻ്റെ പ്രശ്നം ആളുകൾക്ക് വരുമ്പോഴേക്കും ഇതൊരു ലേറ്റ് സ്റ്റേജ് ആയിട്ടുണ്ടായിരിക്കും. ഓക്കെ, ഫോർ എക്സാമ്പിൾ ഒരു ബ്രസ്റ്റ് ക്യാൻസർ ആണെങ്കിൽ ഒരാൾക്കൊരു മാകിലൊരു മുഴ വരുന്നു. ആ മുഴ വന്ന് സ്വയമായിട്ട് ഇങ്ങനെ ഒരു മുഴയുണ്ട് എന്ന് കണ്ടെത്തി ഒരു ഡോക്ടറെ അടുത്ത് പോയി ബയോപ്സി എടുത്ത് ഇത് വരുമ്പോഴേക്കും ഒരു സ്റ്റേജ് 3-ലേക്കോ സ്റ്റേജ് 4-ലേക്കോ പോയിട്ടുണ്ടായിരിക്കും. അല്ലെങ്കിൽ ഫോർ എക്സാമ്പിൾ ലങ് ക്യാൻസർ, സംബഡി സ്റ്റാർട്ട്സ് ഹാവിങ് ലൈക്ക് coughing or coughing blood, he go to a doctor. By the time we diagnose, it become a stage 3 and stage 4. So if you want to diagnose cancers in the early stage, you have to visit a doctor when you are healthy. You have to go there, find out whether you have this problem. Not when you have a problem, you have to go to a doctor. Before having a problem, you have to go and check whether you have this problem or not. Then only you will be able to diagnose it, so that we can be able to treat it very properly. We will be able to prevent it. I am not saying we are going to diagnose a advanced stage cancer. No, we are going to prevent the cancer by visiting a doctor's clinic on a regular basis. I will tell you how it is. So screening helps detect the cancer before the symptoms show up. It's easier to treat with very lower cost and with very good prognosis. Much higher survival rate than the late stage cancer. So can we screen or early detect all cancers? Probably no. We won't be able to screen all cancers. But most of the common cancers, I have already told you which are the most common cancers. Most of the common cancers are screenable and early detectable by very simple methods. See, you can see on the left side column, breast cancer, cervical cancer, oral cancer, colorectal cancer, prostate cancer, lung cancer. All these common cancers are easily screenable with very simple, easy methods and early detectable. And all of them are curable if detected early. I underline, curable if detected early. We see which are these cancers. And these 6 cancers constitute 70% of all cancers. ഈ 6 ക്യാൻസറുകൾ കൂടിയാൽ എല്ലാ ക്യാൻസറുകളുടെയും 70% കഴിഞ്ഞു. ഇനി ബാക്കി എല്ലാ 200-ലധികം ക്യാൻസറുകളുണ്ട്. ബാക്കി എല്ലാ ക്യാൻസറുകളും കൂടി ആകെ 30% ഉള്ളൂ. And these 6 cancers are screenable and early detectable. We'll see few cancers. So these are most common cancers in India, and this is the most common cancers in the world too. So we see the most common cancers. We start with females. We start with breast cancer. Breast cancer is the most common cancer in the world. It's the most common cancer in India. It's the most common cancer in Oman. It's the most common cancer in Kerala. It's the most common cancer everywhere. So it's a present 1 in 4 of the people are diagnosed with breast cancer, and starts at the age of 30 and advances to 50 to 64 years. In cities, 1 in 22 will develop breast cancer. And in villages, 1 in 60 women will develop breast cancer. These are the statistics. So what are the usual symptoms of breast cancer? These are the usual symptoms. You can see it can be a small swelling in the breast, or it can be a nipple retraction. മുലക്കണ്ണി ഉള്ളിലേക്ക് വലിഞ്ഞിരിക്കുക. It can be a nipple retraction, or it can be a nipple discharge. ചുവന്നതോ വെള്ളയോ രക്തം കലർന്ന ഫ്ലൂയിഡ് നിപ്പിളിൽ നിന്ന് പുറത്തേക്ക് വരിക, അല്ലെങ്കിൽ നിപ്പിൾ ഉള്ളിലേക്ക് വലിഞ്ഞിരിക്കുക. There's a change in the skin color and texture, or there's a skin irritation or dimpling. These are the usual symptoms of breast cancer. If any of you are having any of these symptoms, please don't wait. Please go and meet your doctor immediately. But once you develop these symptoms, most of the times it will be in a little advanced stage. So how can you do? So is there a screening facility for breast cancer? Yes, there is a simple screening facility available for breast cancer. There are different like guidelines in the world, like NCC and WHO guidelines. So what are the usual guidelines? I'll talk about it. The first part is a clinical breast examination. What is a clinical breast examination? Every female about 30 years of age, every female about 30 years of age should undergo a clinical breast examination by a doctor or a certified healthcare, trained healthcare worker once in a year. എല്ലാ സ്ത്രീകളും 30 വയസ്സിന് മുകളിലുള്ള എല്ലാ സ്ത്രീകളും വർഷത്തിൽ ഒരു പ്രാവശ്യം നിങ്ങളുടെ സ്തനങ്ങൾ ഒരു ഡോക്ടറെ കൊണ്ടോ അല്ലെങ്കിൽ ട്രെയിൻഡ് ആയിട്ടുള്ള ഒരു ഹെൽത്ത് കെയർ വർക്കറെ കൊണ്ടോ പരിശോധിപ്പിച്ചിരിക്കണം. നിങ്ങൾ സ്വയം പരിശോധിച്ചാൽ പോരാ, ട്രെയിൻഡ് ആയിട്ടുള്ള ഒരു ഡോക്ടറോ ഒരു ഹെൽത്ത് കെയർ വർക്കറോ വർഷത്തിൽ ഒരു പ്രാവശ്യം കൈവച്ച് പരിശോധിച്ചിരിക്കാം. ഇറ്റ്സ് നത്തിങ് വളരെ ഭീകരമായിട്ടുള്ള ഇൻവെസ്റ്റിഗേഷനോ ബുദ്ധിമുട്ടോ ഒന്നുമല്ല പറയുന്നത്. ജസ്റ്റ് ഒരു പരിശോധന മാത്രം ചെയ്യണം. എന്താണ് ഇതുകൊണ്ടുണ്ടാവുന്ന യൂസ്? ഇന്ത്യയിൽ മാത്രം എല്ലാ സ്ത്രീകളുടെയും സ്ഥലങ്ങൾ ഒരു വർഷത്തിൽ ഒരു ഡോക്ടർ പരിശോധിക്കുന്നു എന്നുണ്ടെങ്കിൽ വി ക്യാൻ റെഡ്യൂസ് 15,000 ഡെത്ത്സ് ഡ്യൂ ടു ബ്രസ്റ്റ് ക്യാൻസർ എ ഇയർ. ഒരു വർഷം 15,000 ഡെത്ത് ഇന്ത്യയിൽ മാത്രം നമുക്ക് തടയാൻ സാധിക്കും. എങ്ങനെ? ജസ്റ്റ് ഒരു ക്ലിനിക്കൽ പരിശോധന ചെയ്യുന്നതിലൂടെ മാത്രം. ബട്ട് ലോ മിഡിൽ ഇൻകം കൺട്രീസ് എല്ലാം കൂടി നമുക്ക് ലോകത്തിൽ 40,000 മരണങ്ങൾ ഒരു വർഷം തടയാൻ സാധിക്കും. ഒരു ക്ലിനിക്കൽ എക്സാമിനേഷൻ ജസ്റ്റ് കൈവച്ച് പരിശോധിക്കുന്നതിലൂടെ മാത്രം നമുക്ക് തടയാൻ സാധിക്കും. സോ any female about 30 years of age should undergo a clinical breast examination once in a year by a doctor or a trained healthcare worker. Is this enough? No, this is not enough. There is a second part of it. This is known as breast self-examination. I am not going into details of this. So every female about 25 years, 30 വയസ്സിലായിരുന്നു നമ്മൾ ക്ലിനിക്കൽ ബ്രസ്റ്റ് എക്സാമിനേഷൻ സ്റ്റാർട്ട് ചെയ്യുന്നത്. about 25 വയസ്സിന് മുകളിലുള്ള എല്ലാ സ്ത്രീകളും മാസത്തിൽ ഒരു പ്രാവശ്യം സ്വയസ്തന പരിശോധന ചെയ്യേണ്ടതാണ്. Every female about 25 years of age should undergo a self breast examination. It is known as breast awareness. You should know your breast. Self breast examination once in a month. എപ്പോഴാണ് ചെയ്യേണ്ടത്? The best time is 7 to 10 days after the starting of periods. പീരീഡുകൾ തുടങ്ങി 7 മുതൽ 10 ദിവസത്തിലാണ് ഈ ചെയ്യാനുള്ള ഏറ്റവും ബെസ്റ്റ് സമയം എന്ന് പറയുന്നത്. എങ്ങനെയാണ് ചെയ്യേണ്ടത്? അതിന് 3 സ്റ്റെപ്പുകളുണ്ട്. ഞാൻ സ്റ്റെപ്പുകൾ ജസ്റ്റ് ഓടിച്ചു പോകാം. സോ ആദ്യമായി യു ഹാവ് ടു സ്റ്റാൻഡ് ഇൻ ഫ്രണ്ട് ഓഫ് എ മിറർ, അൺഡ്രസ് യുവർ സെൽഫ്, ഫുള്ളായിട്ട് എക്സ്പോസ് ചെയ്യുക. ഈ അര വരെയെങ്കിലും ഫുള്ളായി എക്സ്പോസ് ചെയ്യുക. ഒരു മിററിൻ്റെ മുമ്പിൽ നിൽക്കുക. 2 സ്ഥലങ്ങളും ഒരേപോലെയാണോ? എന്തെങ്കിലും സൈസിൽ വ്യത്യാസമുണ്ടോ? ഷേപ്പിൽ എന്തെങ്കിലും വ്യത്യാസമുണ്ടോ? എന്തെങ്കിലും നിറ വ്യത്യാസമുണ്ടോ? ഇനി ഷേപ്പിംഗ്, കളർ, structure of the breast, you have to just check in the mirror. This is the first part. Second part, raise your hands like this and look for the same thing. Is there a change in color, shape or size of your breast, both breasts? Just compare both the breasts. Just look at it. Third part is the like you have to press and see. So you have to lie down on a bed. Keep your hand behind your head. ഏത് സ്ഥലമാണ് പരിശോധിക്കുന്നത് ആ കൈ തലയുടെ പുറകിലേക്ക് വയ്ക്കുക. ലെഫ്റ്റ് ബ്രസ്റ്റാണ് പരിശോധിക്കുന്നതെങ്കിൽ ലെഫ്റ്റ് കൈ തലയുടെ പുറകിലേക്ക് വയ്ക്കുക. റൈറ്റ് ഹാൻഡ് കൊണ്ടാണ് നമ്മൾ പരിശോധിക്കുന്നത്. കൈയുടെ ഈ 3 ഭാഗങ്ങളായിരിക്കണം യൂസ് ചെയ്യുന്നത്. ഈ ഭാഗം വെച്ച് പരിശോധിച്ചാലോ ഈ ടിപ്പ് വെച്ച് പരിശോധിച്ചാലോ നിങ്ങൾക്ക് അത് മനസ്സിലാകുകയില്ല. ഈ കൈയുടെ ഈ 3 ഭാഗങ്ങൾ, ഈ ഫിംഗേഴ്സിൻ്റെ ഫ്രണ്ടിലുള്ള ഈ 3 ഭാഗങ്ങൾ യൂസ് ചെയ്ത് റൗണ്ട് ഷേപ്പിൽ എല്ലാ ഭാഗവും നന്നായി അമർത്തി പരിശോധിക്കുക. ഒരു 2 റൗണ്ട് ഏറ്റവും മൂന്നാമതായിട്ട് നടുവിൽ നിപ്പിളിൻ്റെ ഭാഗത്തും അമർത്തി പരിശോധിക്കുക. എന്തെങ്കിലും തരത്തിലുള്ള മുഴകൾ നിങ്ങൾക്ക് കാണുന്നുണ്ട് എന്നുണ്ടെങ്കിൽ പെട്ടെന്ന് തന്നെ നിങ്ങളുടെ ഡോക്ടറെ കാണുക. 5ാമത്തെ സ്റ്റെപ്പ്, നിങ്ങൾ കുളിക്കുന്ന സമയത്ത് കയ്യിൽ അല്പം സോപ്പൊക്കെ ആയതിനു ശേഷം കൈ ഉയർത്തി ഇതുപോലെ തന്നെ പരിശോധിക്കുക. ഈ 4 സ്റ്റെപ്പുകൾ മൂലം, 4 മുതൽ 5 വരെ സ്റ്റെപ്പുകളുണ്ട്. 4 സ്റ്റെപ്പുകൾ മൂലം എല്ലാ മാസവും ഒരു പ്രാവശ്യം ഇത് ചെയ്യേണ്ടതാണ്. എപ്പോഴാണ് ചെയ്യുന്നത്? പീരീഡ്സ് തുടങ്ങി 7 മുതൽ 10 വരെ ദിവസങ്ങളാണ് ഏറ്റവും ബെസ്റ്റ് സമയം. പീരീഡ്സ് കഴിഞ്ഞിട്ടുള്ള എൽഡേർലി ആയിട്ടുള്ള സ്ത്രീകളാണ് എന്നുണ്ടെങ്കിൽ കൃത്യമായിട്ട് മാസത്തിൽ ഒരു ദിവസം നിശ്ചയിക്കുക. പോസ്റ്റ് മെനോപോസൽ വുമൺ ജസ്റ്റ് പ്ലേസ് എ ഡേറ്റ് every day, like every month, 5th of every month or 10th of every month. Just keep a date and do the breast examination on the same day. This is not enough. You have to do a clinical breast examination by a doctor or a healthcare worker once in a year. You will be able to reduce 40,000 deaths per year. Some of the guidelines say above after 45 years, once in a year, doing a mammogram is also good. But a good clinical breast examination is as equivalent to a mammogram. Even if you don't do a mammogram, that is okay. But you have to do a clinical breast examination and a self breast examination every day. I'm very stressing this point to women and my male friends. Please request your wives, your sisters, your mothers, your daughters to do a self breast examination. Breast cancer is the most scariest disease. I told you, if you diagnose them at a stage 1, the 10-year survival rate is 97%. That's almost curable. But if you dictate them at stage 4, 5-year survival rate is only 22%. It's the most common cancer in the world. It's the most common cancer in India, most common cancer in Kerala, most common cancer everywhere. So please be aware of this. Start awareness about your breast today itself. If needed, doctors will advise you mammogram or a ultrasound or a FNAC or a biopsy when required. So that's the next part. That will go to it. Second, again I'm talking to ladies only. The second part is cervical cancer. ഗർഭാശയ വായ് എന്ന് പറയും. യൂട്രസിൻ്റെ ഏറ്റവും താഴെയുള്ള ഭാഗത്തെയാണ് ഗർഭാശയ വായ് അല്ലെങ്കിൽ സർവിക്സ് എന്ന് പറയുന്നത്. Second part is a cervical cancer. So this month, January, is cervical cancer awareness month. So WHO is recommending January as cervical cancer awareness month. So cervical cancer is a preventable cancer. WHO is asking us to get informed, get screened, get vaccinated. So first part I'm doing it here, get informed. That's what I'm doing. Get screened and get vaccinated is up to you. We'll discuss on what to do on it. So cervical cancer, it's 5.9 cancer of all cancer cases in Oman. It's around 18% of all cancer in women in India. Median age is 38 years. The survival change of the person become better if the cervical cancer is diagnosed early. So these are the usual symptoms. It usually symptoms is bleeding. So it can be bleeding between your periods. It can be bleeding after your periods, or it's an excessive bleeding to the periods. Or like if it's a like postmenopausal lady, any bleeding after postmenopausal is very, very important. Any bleeding after postmenopausal period. I'm just putting that word. ഒരു ആർത്തവ വിരാമം വന്നിട്ടുള്ള ഒരു സ്ത്രീ ആണെങ്കിൽ അതിന് ശേഷം ഒരു തുള്ളി ബ്ലഡെങ്കിലും വരുന്നുണ്ട് എന്നുണ്ടെങ്കിൽ ദാറ്റ് ഇസ് വെരി, വെരി ഇമ്പോർട്ടൻറ്റ്. ആർത്തവ വിരാമത്തിന് ശേഷം ഒരു തുള്ളി ബ്ലഡെങ്കിലും വരണം. 6 മാസം ആർത്തവം നിന്നതിന് ശേഷം ഒരു പ്രാവശ്യം, ഇറ്റ് ക്യാൻ ബി സ്പോട്ടിങ്, ഒരു തുള്ളിയെങ്കിലും ബ്ലഡ് വന്നിട്ടുണ്ടെങ്കിൽ അത് ഓക്കെ എന്ന് വിചാരിച്ചിരിക്കരുത്. യു ഹാവ് ടു മീറ്റ് യുവർ ഡോക്ടർ immediately. So that can be a cause. Or a foul smelling vaginal discharge. So these are the usual symptoms of cervical cancer. So there is a WHO mandate to eliminate cervical cancer by the year 2020. നിങ്ങൾ ഒരു ക്യാൻസർ എലിമിനേറ്റ് ചെയ്യുന്നതിനെ കുറിച്ച് കേൾക്കുന്ന ഒരു പക്ഷേ ആദ്യമായിട്ടായിരിക്കും. പോളിയോ നിർമ്മാർജ്ജനം ചെയ്തതിനെക്കുറിച്ച് നമ്മൾ കേട്ടിട്ടുണ്ട്. സ്മോൾ പോക്സ് നിർമ്മാർജ്ജനം ചെയ്തതിനെക്കുറിച്ച് നമ്മൾ കേട്ടിട്ടുണ്ട്. അതുപോലെ നമുക്ക് നിർമ്മാർജ്ജനം ചെയ്യാൻ പറ്റുന്ന, എലിമിനേറ്റ് ചെയ്യാൻ പറ്റുന്ന ഒരു ക്യാൻസറാണ് സർവൈക്കൽ ക്യാൻസർ എന്ന് പറയുന്നത്. ഇന്ത്യയിൽ സ്ത്രീകളിൽ സെക്കൻഡ് മോസ്റ്റ് കോമൺ ആയിട്ടുള്ള സർവൈക്കൽ ക്യാൻസർ can be eliminated by a 90-70-90 strategy. So what is a 90-70-90 strategy? 90% of girls under the age of 15 should be fully vaccinated. I already told you about vaccination. So 90% of girls under the age of 15 should be fully vaccinated. Second part, 70% of the women should be twice screened for HPV. And third part is 90% cases should be treated. I'll come to the second part, screening. So cervical cancer is caused by a virus known as HPV, human papilloma virus. Sorry, I don't have that slide. Okay. So once a HPV enters a woman's body, it will take around 10 to 15 years to develop into a cancer. Okay. ഒരു ഹ്യൂമൻ പാപ്പിലോമ വൈറസ് ഒരു സ്ത്രീയുടെ ശരീരത്തിൽ വന്നാൽ അതിനൊരു ക്യാൻസറായി മാറുന്നതിന് ഏകദേശം 15 വർഷം 10 മുതൽ 15 വർഷം വരെ എടുക്കും. If we screen this lady at least once in this long window period of 15 years, we will be able to screen her and detect it. We will be able to prevent her from developing into cancer. ഈ 15 വർഷത്തിൽ ഒരു പ്രാവശ്യമെങ്കിലും നമ്മൾ പോയി അവിടെ HPV ഉണ്ടോ എന്ന് നോക്കി HPV ഉണ്ടെങ്കിൽ നമുക്ക് അതിന് അവിടെ വെച്ച് ക്യാൻസർ ആയിട്ടില്ല, ക്യാൻസർ ആവാനുള്ള സാധ്യതയിൽ തന്നെ അതിനെ പൂർണ്ണമായി ചികിത്സിച്ച് മാറ്റുകയും വളരെ ചെറിയ വളരെ സിമ്പിൾ ചികിത്സകൾ കൊണ്ട് ചികിത്സിച്ച് മാറ്റുകയും ക്യാൻസർ വരുന്നതിൽ നിന്ന് പൂർണ്ണമായി തടയുകയും ചെയ്യാം. ഓക്കെ, ഹിയർ നമ്മൾ ബ്രസ്റ്റ് ക്യാൻസർ നമ്മൾ ഏർലി ഡിറ്റക്ഷൻ ആണ് പറഞ്ഞുകൊണ്ടിരുന്നത്. ഇവിടെ നമ്മൾ കംപ്ലീറ്റ് പ്രിവെൻഷനെ കുറിച്ചാണ് സംസാരിക്കുന്നത്. HPV ഇൻഫെക്ഷൻ ഉണ്ടെങ്കിൽ നമ്മളതിനെ കണ്ടുപിടിക്കുകയും പൂർണ്ണമായി തടയുകയും ചെയ്യാനായിട്ട് നമുക്ക് സാധിക്കും. സോ ദാറ്റ് ടെക്നിക് ഈസ് അവൈലബിൾ, ദാറ്റ് ഇസ് നോൺ ആസ് HPV ടെസ്റ്റിംഗ്. വെൻ ഹാവ് ടു ഡു എവറി ഫീമെയിൽ അബൌട്ട് 30 years have to do once in 10 years. Once in 10 years, 2 times in your lifetime. WHO is recommending age of 35 and age of 45. If 2 times your HPV is negative, that means you will not develop cervical cancer in your lifetime. So this is a lifetime chance. You have to do it just 2 times in your lifetime. It's not a very difficult test. It's a smear test. Initially, some of you would have heard about pap smear and all. So we were using pap smear previously. Now pap smear is obsolete. HPV is the test of choice at present. Pap smear have to be repeated once in 2 years, but HPV can be repeated only once in 10 years. So it's a HPV DNA testing, like an RT-PCR testing, just like COVID. It's an RT-PCR testing. It can be done once in 10 years. It's a fully automated test. We'll be able to find out the infection of HPV and can be treated in the pre-cancerous stage itself. It's a pre-cancer stage, so we'll be able to treat it. So the second part is a pap test, which is an obsolete now actually. Nobody uses, or like WHO is not recommending it. So it also can be tried once in 2 years. Third part is about the colon cancer. So colon and rectal cancer is the most common cancer in males in India. In females, it's the second, sorry, not in India, in Oman. In males, in India, it's the third most common cancer in males. So it happens in almost 13.9% of male cancer and 5.6% of female cancers. Again, the risk factors are smoking, alcoholism, family history of cancer. Colon cancer sees in the family, like it's a familial cancer. It's a genetic cancer, it's a familial cancer. So if the father or brother is having a colon cancer, there's a chance that this person is also going to develop cancer. So that have to be looked at. Body weight, physical activity, and dietary factors like energy rich foods, fast foods are more commonly used. This barbecued food, smoked food, all these are, there's a chance of developing colon cancer. That's why probably the GCC countries, colon cancer is one of the most common cancer. And some of the other diseases of the large intestine like ulcerative colitis, Crohn's disease, this also causes colon cancer. What are the signs and symptoms? The usual signs and symptoms: blood and mucus in the stools, or alternating bowel habits. That means having diarrhea and constipation alternatively. You will have constipation for few days, followed by diarrhea for another few days. Again constipation for few days, followed by diarrhea. If these kind of alternating bowel habits are there, which last more than 3 weeks, or if there is a bleeding or blood or mucus in the stools, which lasts for more than 3 weeks, we have to be well aware of it, and we have to see a doctor immediately to look for colon cancer. Colon cancer can be early detected? Yes. Colon cancer is a screenable cancer. It can be screened using a very simple test known as FIT test. It's a very simple test, stool test. We look for blood, presence of human blood in the stools. That can be done. That's available in Badar Samaa. Who have to do it? Everybody above 45 years. Everybody above 45 years have to do this test at least once in a year. If you have done it 2 times, it's negative, you can take a long break. So otherwise, everybody above 45 years have to do it once in a year. Or if you have any of the symptoms. So I just move forward. The next part is oral cancer. So oral cancer is the most common cancer in India, in males. India is known as the capital of oral cancer because of use of tobacco, nothing else. We use a lot of tobacco, so that's why oral cancer most common cancer in males. So these are the usual symptoms. It can be persistent white or red patch in the mouth. The good thing about oral cancer is oral cancer always comes with a pre-cancerous lesion. ക്യാൻസറിന് മുമ്പുണ്ടാവുന്ന ഒരു സ്റ്റേജ്, ഒരു പ്രീ ക്യാൻസറസ് സ്റ്റേജ് എപ്പോഴും ഓറൽ ക്യാൻസറിന് ഉണ്ടാവും. വായയിൽ കാണുന്ന വെളുത്തതോ ചുവന്ന നിറത്തിലുള്ളതോ ആയ പാച്ചുകൾ വായിൽ പോവാതെ 3 ആഴ്ചയിൽ കൂടുതൽ നിൽക്കുന്ന പാച്ചുകൾ ഉണ്ടെങ്കിൽ ഒട്ടും വെച്ചുകൊണ്ടിരിക്കരുത്. You have to see a doctor immediately. So it can known as, you can see the pictures here. There's a white patch or a red patch here. These are leukoplakia or erythroplakia. Any of these pre-cancerous lesions will be there in the mouth. So this will not scrape. നമ്മളൊരു വായിൽ എന്തെങ്കിലും ഇട്ടിങ്ങനെ ചരണ്ടി കഴിഞ്ഞാൽ അത് പോകില്ല. സോ അങ്ങനെയുള്ള സാധനങ്ങൾ അത് അപ്പോൾ ക്യാൻസർ അല്ല, പിന്നീട് ഇത് ക്യാൻസറായി മാറാനുള്ള സാധ്യത വളരെ കൂടുതലാണ്. There's a 40% chance that erythroplakia will develop into cancer. There's 17% chance that leukoplakia will develop into cancer. So these can be treated then and there before it develops into cancer. So especially this sees in people who use tobacco. Though it can see in people who don't use tobacco also. So most common causes like sharp tooth. ചില സമയത്ത് നമ്മുടെ ഒരു പല്ലിങ്ങനെ ഭയങ്കര ഷാർപ്പായിട്ട് ഇരിക്കും. പല്ലുമ്മ കടിക്കുമ്പോൾ ഇവിടെ ഒരു മുറിവ് വരും, അതവിടെ ഇരിക്കും, നമ്മൾ നോക്കില്ല. രണ്ടാമതൊരു മുറിവ് വരും, മൂന്നാമതൊരു മുറിവ് വരും. ആ മുറിവ് അവിടെ ഇരുന്ന് പിന്നീട് അത് ക്യാൻസറായി മാറും. സോ ജസ്റ്റ് പല്ലൊന്ന് ഷാർപ്പൺ ചെയ്ത് കൊടുത്ത് അതൊന്ന് ബ്ലണ്ട് ചെയ്ത് കൊടുത്തു കഴിഞ്ഞാൽ ആ പ്രശ്നം കഴിഞ്ഞു പോകും. ഇങ്ങനെ നമ്മൾ സൂക്ഷിക്കാത്ത മൂലമാണ് പലപ്പോഴും നമുക്ക് ഓറൽ ക്യാൻസേഴ്സ് സീൻ ഇൻ നോൺ സ്മോക്കേഴ്സ് അല്ലെങ്കിൽ നോൺ ടൊബാക്കോ യൂസേഴ്സിൽ കാണുന്നത്. എന്തൊക്കെയാണ് യൂഷ്വൽ സിംറ്റംസ്? എ പെർസിസ്റ്റന്റ് വൈറ്റ് ഓർ മിക്സ്ഡ് ലീഷൻ ഇൻ ദ മൗത്ത്, എ ലംപ് ഇൻ ദ നെക്ക്, എ ക്രോണിക് പെയിൻ ഇൻ ദ മൗത്ത്, ടങ് ഓർ ജോ, ഡിഫിക്കൽറ്റി ഇൻ ചൂയിങ് ഓർ സ്വോളോയിങ്, ഭക്ഷണം ഇറക്കുന്നതിനുള്ള ബുദ്ധിമുട്ട്, ഓർ ഇൻഫ്ലമേഷൻ ലിപ്പ് ഓർ ഗംസ്, ഓർ ചേഞ്ച് ഇൻ വോയിസ്, നമ്മുടെ സംസാരത്തിലുണ്ടാകുന്ന വ്യതിയാനം, സൗണ്ടിലുണ്ടാകുന്ന വ്യത്യാസങ്ങൾ, ഇതെല്ലാം വായിലുള്ള ക്യാൻസറിനോ അല്ലെങ്കിൽ ഹെഡ് ആൻഡ് നെക്ക് റീജിയനിൽ കഴുത്തിലും തൊണ്ടയിലും ഉണ്ടാകുന്ന ക്യാൻസറുകൾക്ക് സാധാരണ കാണുന്ന സിംറ്റംസ് ആണ്. Almost all these cancers are screenable and easily preventable cancers. So there's an 8-step screening method for oral cancer. It's very difficult to do by ourselves. Better to be done by a trained doctor, especially a dentist or somebody have to do. Especially if somebody is a tobacco user, they have to go for a oral cancer checkup. They have to go for a screening of the oral cavity at least once in a year. And next one, I just move forward to the lung cancer. So lung cancer is the killer. It's the 3.7% of all new cancers in Oman. So in India, it's more than 10% actually. What are the risk factors? 95% of lung cancer is caused by smoking. 95% of it is due to smoking. And second most common cause is indirect smoking. If one person in their home is smoking, there's a chance that the other person, maybe the wife, maybe the kids, will also develop lung cancer. So indirect smoking is the second most common cause of lung cancer, followed by asbestosis, some radiations, some other infections like other diseases of the lung like COPD, bronchitis, fibrosis. All these are again caused by smoking only. So these can again lead into cancer. And sometimes family history of lung cancer also is there. What are usual symptoms? Chronic cough and blood in the sputum which lasts for more than 3 weeks. 3 ആഴ്ചയിൽ കൂടുതൽ നീണ്ടു നിൽക്കുന്ന ചുമയും കഫത്തിൽ രക്തത്തിൻ്റെ അംശം കാണുന്നതും ലങ് ക്യാൻസർ ആകാനുള്ള സാധ്യതയുണ്ട്. ഫെറ്റീഗ്, ഷോർട്ട്നെസ് ഓഫ് ബ്രസ്റ്റ്, ചെസ്റ്റ് പെയിൻ, വെയിറ്റ് ലോസ്, അനോറക്സിയ, all these are other usual symptoms of lung cancer. Lung cancer screening is very difficult. Screening എന്ന് പറയുന്നത് വളരെ ഡിഫിക്കൽട്ട് ആയിട്ടുള്ള ഒരു കാര്യമാണ് ലങ് ക്യാൻസർ. ഐഡിയലി യു ഹാവ് ടു ഡു എ ലോഡ് ഓഫ് CT സ്കാൻ. ഒരു CT സ്കാൻ ചെയ്ത് ലങ് ക്യാൻസറൊക്കെ കണ്ടുപിടിക്കുക എന്ന് പറയുന്നത് ഇറ്റ്സ് നോട്ട് വെരി പ്രാക്ടിക്കൽ. So the best practical solution for preventing lung cancer is stop smoking. Or if you are not a smoker, don't start smoking. These are the only two practical solutions for lung cancer. So again, once again, if anybody of you are hearing me is a smoker, please stop it. If you are not a smoker, please don't start it. And the last one I would like to discuss is about prostate cancer. Prostate cancer is a men-specific cancer. It sees in elderly men, usually above the age of 60, most common age of 65 to 79. Family history and genetics is one cause. Body weight and physical activity also increases the chance of getting prostate cancer. So what are the usual signs and symptoms? It's frequent urination, especially at night, and difficulty in urinating, and sometimes blood in the urine, especially in the elderly age group, above 60 years, it can be a symptom of prostate cancer. So how can we diagnose prostate cancer? It is screened by using a very simple blood test known as PSA, prostate specific antigen. WHO recommend every male above 50 years, every male above 50 years have to do this blood test at least once in a year. വർഷത്തിൽ ഒരു പ്രാവശ്യം PSA ചെയ്ത് നോക്കുന്നതിലൂടെ we can reduce the chance of diagnosing prostate cancer. If needed, we'll go for a rectal examination or a ultrasound or biopsy when done if needed. So the screening method is PSA. So these are the most common cancers. And what are treatment? There are different treatment facilities available. It can be surgery, chemotherapy, radiation, hormone therapy. The thing is, if it is diagnosed in the early stage 1 will kandupidichal, any one treatment will be enough. Most of the time surgery മാത്രം മതിയായിരിക്കും, അല്ലെങ്കിൽ റേഡിയേഷൻ മാത്രം മതിയായിരിക്കും. പക്ഷേ സ്റ്റേജ് 3-ലോ സ്റ്റേജ് 2-ലോ ഒക്കെ കണ്ടുപിടിച്ചാൽ mostly it should be a combination of treatment. Somebody will undergo chemotherapy first, followed by surgery, followed by radiation, or like surgery first, followed by radiation, followed by chemotherapy. It will be a very multi-modality treatment, and the side effects is going to be tough. The cost is going to be very high, and the prognosis is not going to be not good. So the best way to conquer cancer is to prevent it or screen it and early diagnose it at the early stages. So this is the importance of early detection. നമ്മൾ കാണുന്ന പ്രധാനപ്പെട്ട 8 ക്യാൻസറുകൾ നമ്മളെല്ലാം കൂടി ഒന്നിച്ച് നോക്കിക്കഴിഞ്ഞാൽ the 10-year survival rate, if it is stage 1, it's around 81%. If it's stage 4, stage 3 and stage 4 combined, stage 1 and stage 2 combined, it's 81%. Stage 3 and stage 4 is combined, it's only 26%. So this is the importance of early detection. Most of the cancers are completely curable if detected early. So that is the information, or that's the message I want to tell you today. If you have any doubts or any concerns, this is a time to ask. We can have some time for doubt clearance. Badar Samaa Hospital along with Karkinos is now having a cancer screening and early detection facilities. We have few packages available for that. It's a very tailor-made packages. We don't do like just package for everybody. It's not like that. It's a very tailor-made packages. We'll initially have a risk assessment about you. Once you come, we have a set of questionnaire. We have a risk assessment about you. After that, we'll do the investigations if required. Like if a 30-year-old male is coming, that's the package is going to be much different from a 65-year-old female. So that's very difficult. So what is required for you, that only will be done in the package. There are two comprehensive package for males and females, which includes all these 6 cancers plus diabetes, hypertension, cholesterol, all the NCDs, all the non-communicable disease also included in the package. That kind of 2 comprehensive packages are available. Then you have breast cancer package, oral cancer package, colorectal cancer package, those kind of packages also. We have a risk assessment facility. Risk assessment means we have a set of questions which is done by a 30+ oncologists from India and US, done with a set of questions which includes the symptoms, the history, the family history. That's a set of questions. By the end of the questionnaire, we will be able to tell you, are you at an elevated risk for developing one particular cancer? All of us are at an average risk. Nobody is at a low risk. All of us are at an average risk. If somebody is at an elevated risk due to some of the reasons, we will be able to find it out from this questionnaire so that we can advise you for the rest, how to take care of you. So we are not looking at the illness. From these packages, we will not diagnose a cancer. No, we are not going to diagnose a advanced cancer. We are going to prevent from the cancer or we are going to do a primary prevention, or we are going to do a secondary prevention. So this is a completely, what I can say, it's a completely preventive part of cancer which we are doing. If anybody of you interested, you can use this opportunity also. We have a number. You can note this number. Any doubts regarding cancer, you can ask this number. It's a very free service. You can ask this number regarding any doubts regarding cancer. So anybody have any doubts or any clarifications? We can have 1 or 2 minutes. So we. Oh, no. Can't you?
എല്ലാ ക്യാൻസറും സിംറ്റംസ് നമുക്ക് കാണിക്കുന്നില്ല. ഏതൊക്കെ പറഞ്ഞ ക്യാൻസർ ഉണ്ട്, ബ്ലഡ് ക്യാൻസർ അല്ലെങ്കിൽ ലിവർ പാൻക്രിയാസ്, അതൊക്കെ നമുക്ക് സിംറ്റംസ് എന്താണ്?
എല്ലാ ക്യാൻസറിനും ഡിഫറെൻ്റ് ആയിട്ടുള്ള സിംറ്റംസ് ഉണ്ട്. എവറി ക്യാൻസർ ഹാവ് ഇറ്റ്സ് ഓൺ സെറ്റ് ഓഫ് സിംറ്റംസ്. ബട്ട് ദ പ്രോബ്ലം ഈസ് most of the times once the symptoms appear, cancer will be in a late stage. So it's very difficult to tell all the symptoms of all cancers. There are 200 plus cancers. So I cannot tell you all the symptoms regarding that. Okay. So the first part is having a preventive or like a good lifestyle. Use a preventive strategy. If you go through these 6 cancers itself, you have covered almost 70% of the cancers. Okay. These 6 cancers include 70% of the cancers. And the rest of the cancers have its own symptoms. If it's a liver cancer, it shows symptoms related to liver. If it's a stomach cancer, it shows symptoms related to stomach. So any symptom that stands more than 3 weeks have to be evaluated. That's a blanket statement, I can say. Like usual infection, it will be 1 to 2 weeks, it will be over. Anything more than 2 to 3 weeks should be evaluated properly. By a doctor. So that's the answer I could tell you now. Cholo.
Breast cancer patient, survey weight. Is there any chance of weight tumor that patient?
2 things. Breast cancer വന്ന പേഷ്യന്റിന് ബ്രെയിൻ ട്യൂമർ വരാനായിട്ട് വേറെ ഏതൊരു വ്യക്തിക്ക് ബ്രെയിൻ ട്യൂമർ വരാനായിട്ട് എത്രമാത്രം സാധ്യതയുണ്ടോ അത്രമാത്രം സാധ്യത ഈ വ്യക്തിക്കുണ്ട്. യു ഗോട്ട് മൈ പോയിന്റ്. ഒരു പ്രാവശ്യം സൈക്കിൾ ഇടിച്ച ആളെ പിന്നീട് ബസ് ഇടിക്കില്ല എന്ന് നമുക്ക് പറയാനായിട്ട് പറ്റില്ല. വേറെ ഒരാൾക്ക് എത്രമാത്രം സാധ്യതയുണ്ടോ അത്രമാത്രം തന്നെ. I'll come to your point. Okay, will develop brain tumor. There's something different known as brain metastasis. Okay, brain metastasis means it's from the breast cancer itself. It can go into the brain. I told you initially, some of the breast cancer cells will shed into the blood and can travel to the brain and can develop cells there. So that is known as metastasis. That's known as brain tumor. It's a breast cancer that grows in the brain. Like if you do a biopsy from that and look at it in the microscope and look at when we do the biopsy, we see the breast cells there, not the brain cells. Okay, so that's known as brain metastasis. So breast cancer is a common cancer which causes brain metastasis. Breast cancer is very common, develop brain metastasis. Especially there are different kind of breast cancer. Like HER2 എന്ന് പറയുന്ന ഒരു മാർക്കർ ഉണ്ട്. HER2 enabled ആയിട്ടുള്ള breast cancerകൾ brain mets ഉണ്ടാക്കാനായിട്ട് വളരെ common ആണ്. So what you are asking is probably that sometimes there won't be anything in the breast. This patient is cured of breast cancer. Maybe after 3 years, after 4 years, breast is completely cured. There is nothing there, but he can develop a metastasis in the brain or metastasis in the liver. So that's a different thing. That happens in stage 3 cancers and all. That chance is small. But for brain tumor as such, it's same as any other person. Okay.
Good evening, Dr.
Good evening.
Thank you so much for the informative session. Actually, I got too many questions, but I will just ask a few. About this screening, before that's possible for us to diagnosed much earlier so that would be a kind of prevention. So the first question is, what's the frequency? Like once we have it done, is it like a lifetime or do we have to do kind of in 2 years, 5 years? That's my first question. Secondly, you mentioned about breast cancer. You say that village in the first stage is functional. That's what I've seen.
Yeah, yes.
But city is Sohar, loving Sohar, 68. What could be the reason for such a big difference between? So, my question is, can't we just whatever on the things that are preventing the village women from having breast cancer, can't we just use that information also to prevent that? That's second question. And about lung cancer.
So I'll finish this and come to the third question.
So I will just ask all the questions so that others also get that.
Okay.
I will be asking, I am doing questions, but I will be asking 3 questions only. And it is for the lack of exercise also leads to cancer. That's something shocking also. Either things like smoking or things are the process. Is it really an alarming factor or is it something that we can ignore? And my last question is like, if someone's a smoker and he or she keeps us smoking, will they still have this
Got it.
risk of getting that cancer, let's say after the decade or so? So I just, these 4 questions here, personally.
Yeah. The first part is about screening. Very good questions. I should congratulate you for those questions. The first part is about the screening. Okay, the screening is different for different cancers. One. So for example, breast cancer, the screening is once in every year. Done once in every year. For cervical cancer, it's once in 10 years. Okay. For colorectal cancer, it should start with once in a year. 2 or 3 times if it's negative, we can change it to once in 2 years. So it's a very, it's not like the usual master health checkup or whatever you do in a hospital. It's not like that. It should be a very organized program for you, and it will be different. Like if you have a high risk of developing breast cancer or colon cancer, say your father is having a colon cancer or your brother is having a colon cancer, your frequency will be much higher. Okay, if somebody's mother is having a breast cancer, we should start the screening from the age of 25. Others start from the age of 30. This lady should start from the age of 25. Some of the familial cancers we start at least 10 years before. If somebody have diagnosed at the age of 40, we should start the screening from the age of 30. Or somebody brother is diagnosed at the age of 35, we should start from the age of 25. So it's very different for different kind of cancers. So the most important thing is at least once in a year you can take. So you have to start with once in a year. Then the screening doctor, once you have a good program, they will advise you when is your next screening time. Okay. If it's like a breast cancer, you have to come for after 1 year. For cervical cancer, you have to come after 10 years. For colon, you have to come after 2 years. So we can give you proper guidance. And it's not only one time. It should be a continuous process. It should be a continuous process. If like you come to me, you do screening today, that means you don't have cancer today. I'm not saying you will not develop cancer tomorrow. Okay, so I'll give you some more advices, what to do after that. All the other preventive strategies like not smoking, good food, and all those things have to be continued. So it's a lifestyle. It's not a one-time activity. Okay, so very simply, at least once in a year, we have to go for screening from age of 30. And we say at least up to age of 65 to 70. We don't screen a 80-year-old person because we are not going to gain much from diagnosing a cancer much. Like why do we want to go through a 80-year-old man? But that's not the case of a 30-year-old person or a 40-year-old person. So at least from the age of 30, some guidelines say 65, some guidelines say up to 70. So at least once in a year, we have to go for screening. And it's different for different cancer that a particular doctor will be advise you depending on the risk you are having. That's why in the first we have a risk assessment. In the end of the risk assessment, we will find out the risk and give the proper plan for you. So that's what is happening. Okay, that's what part. Second part is about the, I think it's about the breast cancer you asked, no? Villages and cities. So, breast cancer was initially seen in urban population. Maybe the diet may be a one reason, the obesity is a second reason, lack of exercise is a third reason, and the usage of some kind of diet, hormones, everything is the other reason. If you look at the village woman, urban woman, most of the girls will attain a menarche at very early age compared to the like a village woman. So attaining a menarche at the early age and menopause at a late age is a risk factor for developing breast cancer. So these are the usual symptoms, usual issues we see in case of a urban woman. So going back to a village, I don't know how easy it is to go back to a village, but yeah, having a good lifestyle with limited like a diet and along with a physical activity will definitely reduce the chance of developing breast cancer. Another thing is lack of breastfeeding. Like if you the breastfeeding have a like a protective effect on breast cancer. The more you breastfeed, the chance of developing breast cancer is less. The age of first childbirth, as early as possible. Like this is a very progressive community. I shouldn't tell these things actually. The early you have a first childbirth, the chance of developing a breast cancer is less. So these are the usual things that happens in between rural areas and urban areas. And things are changing actually. All the rural areas are becoming urbanized nowadays. So that's not going to have a much between change. And third question was? Yeah, as someone stops smoking, the chance of developing a cancer will reduces with time. Like if you smoking today, tomorrow you have almost same chance. After 2 years, you have less chance. After 10 years, you have less chance. So for example, in the case of lung cancer, they say you have to screen a person who has stopped smoker at least 15 years back. So at least up to 15 years, you still have a chance of developing a cancer due to smoking. Okay. So as the time goes, the chance reduces.
The treatment, there's a new issue that gene editing.
Sorry?
Gene editing, that's a kind of new treatment. This is editing our basic genes. Possibly
Yeah. These are new things known as precision oncology. Like Arkinos is an organization which works a lot with this kind of newer things and all. But all these are not very, like not happens in a large number of population. This will be available for very few selected cancers and selected people only, whose genetic level it is. We have to find out the genetic things, and if it is possible, we have to be able to do. But that's possible in only very few numbers, and the cost is very high as of now. We can like hope like it will become more economical, and all of us will be able to get it in the nearby future. Organizations like Arkinos is working very hard for it. Probably we already started a moonshot program. It's not a moonshot program in India. It's already happening in US also. Arkinos is a part of it. We are working towards it. Yes, thank you. Yes, please. Can somebody pass the mic? Yeah, you can ask in mic, please.
Can you give some information about blood cancer?
Yeah.
Reason
Blood cancer, smoking is a reason for blood cancer, and most of the other blood cancer are caused by genetic reasons. Okay, so I cannot tell you these are the risk factors for blood cancer. Okay, most of them are used by genetic mutations that happens inside our body is the most of the causes for blood cancer. Okay, and we cannot screen blood cancer as of now. There is no screening method available, or like screening a blood cancer is not useful. Okay, diagnosing it, there is no stages for blood cancer. So diagnosing it little early will not make much difference in the prognosis. So nobody is doing a screening for blood cancer. Usual symptoms are anemia, usual symptoms are fatigueness, usual symptoms are is there any lymph nodal enlargement in any of the body, like in the head and neck, or in the axilla, or in there's a spleen or a liver, or or if it's anemic, you have to go and meet a doctor early. So these are usual symptoms. Yes.
Thank you, Professor. I have a doubt of speed.
Okay.
You see, there is a lot of actions are available all over the world. But speedy vaccines are not coming. Like a common man, they don't have that information. Even I am giving the right one.
Most of the people are getting information. Yeah.
Is there any particular reason?
Two things. Like cancer vaccines, like WHO's recommendation itself, it's not much common in places like India, or probably in places like Oman also it's not that common. It's very common in places like UK or Australia. Okay, so that's a different scenario. These vaccines become very common when government put it into their program. In India, government have a national immunization program. Okay, for our kids, it's a very free of cost government is giving it. Government have not put that into in the national program as of now. That's why it's not that common. Second thing, the good thing I will tell you, India have approved for a Indian vaccine. The Serum Institute in India is approved for a new vaccine almost two months back. Okay, it have not started coming to the market. So once it start coming to the market, probably in 1 or 2 months it will start coming to the market, then the cost will come down. Now for one vial, the cost is around 6,000 rupees in India. I'm not sure about how much it is in Oman. It's about 5,000 to 6,000 rupees. Once the Indian vaccine come up, the cost will drastically go down. It's already approved by Serum, already the licensed Serum Institute has got it. The manufacturing is going on. Probably in 1 or 2 months we will be able to start the thing also. So then I hope it will become more more popular.
Again, on the same thing, how is this interaction with different vaccines?
So I didn't get you.
There's a lot of vaccines are coming in the market, but like corona vaccines came. Different vaccines have different drugs as well. But this type of HPV, how will be the interaction with other vaccines?
There won't be much interaction. Usually there is no vaccines which we talk about interactions of vaccine. So you need not worry on that part at all. Yeah. Thank you.
Cervical cancer because of the virus is running. So is it contagious?
Cervical cancer HPV വരുന്നത് ലൈംഗിക ബന്ധത്തിലൂടെയാണ് ഈ HPV എന്ന് പറയുന്ന സാധനം കിടക്കുന്നത്. Okay, almost all females will have a HPV infection in their lifetime. So അതാണ് പറയുന്നത്. Almost every എല്ലാവർക്കും ഒരു HPV infection ലൈംഗിക ബന്ധമുള്ള എല്ലാവർക്കും ഒരു HPV infection ഉണ്ടാവാം. സുരക്ഷിതമല്ലാത്ത ലൈംഗിക ബന്ധം, മൾട്ടിപ്പിൾ സെക്ഷൽ പാർട്ട്നേഴ്സ് ഉണ്ടാവുക, നമ്മുടെ പാർട്ട്ണർക്ക് മൾട്ടിപ്പിൾ പാർട്ട്നേഴ്സ് ഉണ്ടാവുക, ഇങ്ങനെയുള്ളവർക്കൊക്കെ HPV ഇൻഫെക്ഷൻ വരുന്നതിനുള്ള ചാൻസ് വളരെ കൂടുതലാണ്. ഓക്കെ, ബട്ട് ഓൾ HPV ഇൻഫെക്ഷൻസ് വിൽ നോട്ട് develop into cancer. Most of them, above 80% of them will disappear by itself. Okay, very few of them, around 20% will become a persistent infection. Some of them will go into a stage known as cervical intraepithelial neoplasia. It's a pre-cancerous lesion, CAN will say, like CAN 1, 2, 3, and later it will develop into a stage known as invasive cancer, cervical cancer. So it will take around 10 to 15 years of time. Okay, so most of the infections will be washed out. Only few of them will develop into cancer. That's why I told we need not do anything on a very early young age group, but after 35 years, after 45 years, we have to do a HPV testing. If it is positive, depending on which HPV it is, we can treat it. We don't do hysterectomy or anything like that. We are not going to do a surgery or anything. We have very small, simple techniques. We can just cryo preservation, something like that we have. We have very small technique we have. We will be able to treat it completely so that it will not develop into an invasive cancer later. Only CAN2 will be treated. Even up to CAN1, if it is, we need not treat the patient at all. We just keep them on follow-up. We will repeat an HPV after 1 year or 1 year. If it is negative, tata bye bye, you can send her home. Okay? But if it is CAN2, we have to treat with a very simple thing. It's a 10 or to 15 minutes in an OPD, in a gynecologist OPD, 10-minute thing, you will be completely cured of this cervical cancer. Not cancer, the precancerous lesion. CAN3 will usually go for hysterectomy. And if it's invasive cancer, they have to take in a different way of treatment. That's it. So if you ask me, it's go through sexual intercourse only. Yeah. നമുക്കിടെ ശരീരത്തിൽ പ്രശ്നം വരുമ്പോഴാണല്ലോ ഇതൊക്കെ വരുന്നത്. ഇപ്പോൾ ലംബ് ശരീരത്തിലുണ്ടായി തുടങ്ങിയിട്ടുണ്ടോ, നമുക്കത് കൈകൊണ്ട് നോക്കി മനസ്സിലാക്കാൻ പറ്റുന്ന സമയമാകുമ്പോഴാണല്ലോ നമ്മളത് കാണുന്നത്. അല്ലെങ്കിൽ നമുക്കൊരു വേദന വരുമ്പോഴാണല്ലോ നമുക്ക് പ്രശ്നങ്ങൾ വരുന്നത്. പക്ഷെ അത് വരാനായിട്ട് കുറച്ച് സമയം എടുക്കും. ഡിപ്പെൻഡിങ് അപ്പോൺ ദ ക്യാൻസർ, the symptoms become like more severe only in a later stage, not in the very early stage. I'm not saying only in third stage, maybe second stage, or like depending upon the stage it will come. And most of the times what we'll do, if there's a small symptom, we are not going to do anything. No, say okay, that's okay, it's a small lump, that's okay, it's a small pain, I can take a tablet. Even some of the doctors will not take it. Like if you have a pain, they will not think this is cancer. They will just do the usual treatment, and you will go forward for few weeks or few months. Then only later we will diagnose like, oh yeah, I should have thought it before, this is cancer. So that also happens. So that's why that's important. That's the importance of screening and early diagnosis. Yeah. Yes, sir. Sorry? Good question. I'll come to that part. So only 5 to 10% of the cancers are familial cancers. Okay, that runs in family. That means if mother is having one particular cancer, the daughter will have that more chance of developing that cancer. Is only 5 to 10% of cancers. Few cancers, especially breast cancer, colon cancer, some prostate cancer, like pancreatic cancer, these are usually seen in families. Most importantly is breast cancer and colon cancer. So there are few genetic status that can dictate whether you have this particular gene. Okay, the most common one is BRCA, BRCA or BRCA1, BRCA2. Two genes are there. If these genes are there, if you have these genes, you have a chance of developing more than 50% chance of developing breast cancer, colon cancer, ovarian cancer. Sorry, I missed ovarian cancer. In males, it is prostate cancer and pancreatic cancer. Okay, so we have genetic tests available. So there are very specific criteria to this genetic testing. We are not supposed to do genetic testing for everybody. We can do a clinical breast examination for everybody. It's not like, come, everybody do a genetic testing. No, it's not like that. There are very specific criteria. Usually this is done in patients first. Okay, if there's a female who is young age, less than 45 years, comes with a breast cancer, she's a triple negative breast cancer. There are different kind of breast cancer. It's a triple negative cancer. Or like one same lady having a left-sided breast cancer and a right-sided breast cancer. Or one person having a breast cancer and plus ovarian cancer, two cancers at the same time. Or like mother and the daughter is having breast cancer, two sisters are having the breast cancer. So like that, there's a very specific criteria. If any of the specific criteria is there, we'll do this genetic testing, BRCA1 testing, BRCA2 testing to this lady. If it is positive, then we have to screen all the first degree relatives. All the first degree relatives, that's mother, father, sisters, daughters, with this BRCA1 testing. We have to do it with the help of a very good genetic counseling. Like Once it is positive, we are going to tell them you have a 50% chance of this cancers. So how to go forward it is also very important. With the help of a genetic counseling, we'll do this for the first degree relatives and take it forward. Probably you have heard about Angelina Jolie. After her incident only, BRCA1 became that much popular. She removed her both breasts. She underwent oophorectomies also because she had BRCA1 positivity. So same way, there are a lot of people nowadays who underwent this. In our lab also, we do a lot of BRCA1 testing. With the help of genetic counseling, we counsel the first degree relatives and do the genetic testing. So that's usually not done in a very commonly in all population. Just go do a genetic test. No, it's not like that. So only in very selected individuals we do the genetic testing. It's around 5 to 10%. It's around 10% we can say. Some studies say in India it's up to 15%. In breast cancer it is hereditary cancers. But the usual in the Western population, most of the data comes from the West actually. So it says up to 10% is hereditary cancers. It's only 10%. 90% is other modifiable things like smoking and all. Only 10% is hereditary cancers. Sir. Sorry, I didn't hear you. Bulky uterus and cancer, there is no much correlation. As far as I know, there is no correlation between bulky uterus. You have the same chance as any other uterus. Yeah. Hi, sir. Thank you. Thank you, sir. Thank you very much.
It was very nice, and I think people might have thought anything about these types of cases. Of course, we are all here expected countries, and but for last day, nobody should have any one of them. So suppose anybody comes to know that there is a initial stage of any type of cancer. So he should not get panicked. Number one is this thing. Number two, I just want to know how Parkinson's is going to help such patients who are present in Oman, who doesn't need to go to India or this person. Because once anybody got COVID, he gets panicked. The first thing is that he has to go for screening, and screening is better than, as you know, that prevention is better than cure. Suppose God he gets it, and he has these actions. How Parkinson's is going to help them in collaboration with Badar Samaa Hospital?
Yeah. So Badar Samaa have started its first phase of this project, or like Badar Karkinos project now. That's about the screening and early detection. We'll start the second phase probably in 3 months time. Some of the doctors' licenses, everything is in process. So we will be starting the cancer treatment facility in Oman itself, probably in Ruvi and Al-Qud. We are thinking about starting something in Sohar also, probably in the next stage, the treatment itself. Okay, so that will be including the chemotherapy, surgery. For chemotherapies, we'll be able to do here. For the surgeries, we have experts from India, Karkinos experts. Karkinos experts, like we have people from all over the world. We have a tumor board facility. That means every case will be discussed in a tumor board. The tumor board will have all the experts, like surgical oncologists, medical oncologists, radiation oncologists, senior radiologists, pathologists, everybody will be available. We discuss every case, make a proper treatment plan for this particular patient, then only we start the treatment for the person. So we'll be able to start the treatment process also in Oman itself. Our doctors can come here, they can do the surgery, they can go ahead and do that. And Karkinos have a lot of centers in all over the India. In Kerala we have 13 centers. We have places all over India also. We have tie-up with them. So we'll be able to send them to the right place. Okay, we have to make a proper treatment. If they want to go home, they want to go to India and take treatment, we will be able to make the right treatment decision for them with the help of the tumor board. We will send them to the right place so they can have the treatment. They can come back. We can have the follow-up and everything here if they want to get treatment there. Or if they want to get treated here, we will be able to give the treatment here also as much as possible. As of now, only apart from radiation, all the other treatments will be available here, probably in next 3 months time, hopefully, I'm not saying it, but hopefully in another 3 months time, we'll have the treatment facilities also available in here. Licensing process of many of the doctors are going on, so it will take another 2 to 3 months probably. Yeah, so we are looking forward for, Karkinos is looking forward for a distributed cancer care model. So we start cancer treatments in tier 2 cities. Like I was working in a place known as Kodamangalam, Todupuzha, Moovattupuzha, or Edappal, Thrissur. These places where there was no big centers were available, we start cancer centers. So nowadays, all the on-calls need not sit in a single room. No, we can all contact through online basis. Only one person is available. They will see the patient. All the 30, 35 very senior people from TMH Mumbai, from AIMS, from RCC, everybody will sit together, discuss about this patient, make the best treatment plan, and that can be utilized in Kodamangalam or Sohar or anywhere else. The treatment plan is made by the experts. We have our experts from Mayo Clinic in USA and other places also. So we all come together, we make the correct treatment plan. So this is a distributed cancer care model rather than a centralized model. So that's what we are looking at. Thank you for that, sir.
Regarding that HPV vaccine, the human papilloma vaccine you already mentioned. So is it useful only for cervical cancer or any cancer also? Is HPV vaccine?
So it is useful for, it is mainly studied for cervical cancer. It is used for vaginal and vulval cancer for females. Okay. In India, it is not permitted to use in males as of now. Okay. There are studies going on for pineal cancer and all, but as of now, India have not got licensed for males. It's only for females as of now. Yeah. Pineal, as you pointed, pineal cancer is also caused by HPV. And now there are a lot of oropharyngeal cancers like tonsil and oropharyngeal region cancers are also caused by HPV. Basically those who mainly use like oral sex and all, there's a chance that oropharyngeal cancers are also caused by HPV virus. But HPV vaccine is not licensed to use in these population. Skin cancer. Okay, skin cancers are basically, there are 3 types of skin cancers. It's known as squamous cell carcinoma, basal cell carcinoma and melanoma. Okay, a squamous cell carcinoma usually comes as a cauliflower-like growth in any of the body, can be any of the extremities. The usual thing is it starts from a ulcer. There's a chronic long-standing ulcer, maybe a venous ulcer, maybe a Burns ulcer, some kind of ulcer is there which long-standing there, then it changes into a cancer. And the second part is a melanoma. It usually comes as a black color mole. So if you see a black color mole which is raised from the skin, if it is just to the skin, it's okay. If it is raised from the skin, if the edges are not very well defined, if edges are like little indurated kind of edges, if it is raised from the skin, if it is itching and if the size is increasing, if it's a black in color, we have to be careful about the melanoma. And other things are like long-standing ulcers can again develop into like squamous cell carcinomas. So that also, if it's a long-standing ulcer more than 1 month and all, you have to see a doctor immediately on that. Yeah. Anything else? I think I took a lot of time, I think. Yeah, so thank you everybody. Thank you Sohar for the nice time. Thank you very much.
Thank you, Doctor. Thank you, Dr. Boyce, for giving such a wonderful presentation as well as the subject has been covered very nicely. Hope we
Thank you.
all
What number?
enjoyed and we all gathered the information what we require. Now, let's welcome Dr. J. Prabhakaran, leading consultant cardiologist, for a live CPR demonstration. This is our second session. So I request all the people who are sitting on the back side to please come on the front to see the live CPR demonstration which will be conducting by Dr. J. Prabhakaran. So please. Please, those who are sitting in the back side, please come on front. All the people, all the friends, please come to the front side.
Hello.
So good evening everyone. So I'm Dr. Prabhakaran, cardiologist from Badar Samaa Hospital. So as was, you know that cardiovascular disease is one of the leading causes of death in the world. As per the WHO, as per the WHO, World Heart Organization, so in 2019 and 2020, it's nearly 18 million people have died all over the world because of cardiovascular disease. Cardiovascular disease includes both heart attack as well as stroke. Among that, 85% of the cases are due to heart attacks. So here, most of the cases of heart attack, you know very well that there are behavioral risk factors like family history, age, sex. These are all non-modifiable factors, but behavioral risk factors like your lifestyle, unhealthy diet, tobacco smoking, lack of physical inactivity, obesity. So all these are all leads to the your heart attacks. So when a patient, see, heart attack and cardiac arrest are two different things. So heart attack happens because of the blockage in your arteries, where the heart itself doesn't get blood supply and oxygen. Whereas cardiac arrest is an electrical phenomenon where it happens because of heart attack. Cardiac arrest happens because of other reasons also, and heart attack is one of the most #1 cause for cardiac arrest. So patients come to the hospital walking, and patient present their symptoms in the emergency room. We do an ECG. Within the next second, patient goes into cardiac arrest. We have encountered many cases like that. But in hospital cardiac arrest, we are there. Code Blue team is there in hospital, where immediately we attend to the patient, and many patients were revived from the cardiac arrest. Many patients have got treated, they have walked out of the hospital. But what in case one of you sees somebody collapses outside the hospital? We have been hearing many incidences like last week also, or a few days ago, we have seen one sports person collapsed and then they couldn't revive him. Even 2 days back, one of my patient came with very anxiety. He said like he saw one of his neighbor collapsing in front of him. He spoke to him, he walked away, he saw him in front of him, he collapsed, he couldn't do anything, and he was declared dead. So even we can encounter many such situations in our life. Out of hospital cardiac arrest. So you can see a patient, somebody collapsing there. But what you are supposed to do is call the emergency number in Oman. That is, anybody knows what is the emergency number in Oman? 9999. That is the emergency contact number in Oman, where you can dial in case of emergencies. Until then, whenever such situation happens, you dial there. By the time the emergency medical team arrives, precious time is lost in saving the patient. You can learn how to do a cardiac resuscitation and improves the chances of survival for a person. You can save a life if you have a knowledge about how to do a cardiopulmonary resuscitation. See here, out of the hospital, we train only hands-on CPR. Hands-on CPR in the sense it's only just compression. In hospital, we train as cardiopulmonary resuscitation, where we give chest compression as well as ventilation techniques in the ratio of 30:2. Here, we eliminate the mouth-to-mouth breathing is not here. We help you in training hands-on CPR demonstration. For example, if somebody, you're talking to somebody like in the public, somebody collapses, so what to do next? So whenever somebody collapses like this, for example, this is the person who has collapsed. You should first verify scene is safe. Somebody can collapse in the bathroom, somebody can collapse in a water area or electric area, or some chemicals may be spilled around. Like, first you should verify the scene is safe. That means you should be safe from other dangerous items like electricity, water, or chemicals spilled around there. Make yourself the scene is safe, and then shout or tap at the patient. You should tap on the shoulders very loudly. Call him, hello. So now he is not responding. If he is not responding, then feel for the carotid pulse. Feel for the carotid pulse. Carotid pulse, you can just feel from lateral wards from the neck, that is the cricoid cartilage. From the cricoid cartilage, slide the finger either to the right or to the left. You can feel for the carotid pulse. At the same time, you can see whether he is breathing or not. Your assessment should be less than 5 to 10 seconds, that's it, not more than that. If you feel there is no pulse, is not breathing, immediately start the chest compressions. So, where do you do the chest compressions? You have to keep your fist over the lower third of the sternum, that is the breastbone. This is where you keep your hand. First keep your right hand or a left hand over the lower 1/3 of the sternum or the lower third of the breastbone. Interlock with your left hand. Make a fist and then start compressing. Start compressing. Your compression should be of high quality, we call it as. High quality in the sense like the chest compression should be at least at a depth of 2 inches or 5 centimeters. And the speed should be around 100 compressions to 120 compressions per minute. So this is how you give a chest compressions. In the hospital, we give 30 compressions to 2 ventilations. 30 chest compressions to 2 ventilation techniques. We have a ambu bag, so we give with that. But out of the hospital, in a public place, so you won't have a mask or you won't have a ambu bag for ventilation. So keep continuing with the chest compressions. A partial blood pumping can improve the chances of survival of a person who has collapsed until the medical team comes and takes over the scenario. So here I am not teaching anything like in detail about what we are doing in the hospital, our code blue team. It's only for you to keep a chest compression going on so that the heart gets a blood supply till the emergency medical technician comes and then takes over the scenario. Okay. I'll ask my colleague to demo one more time. Sir. So he's not responding. He's feeling for the pulse. You can place your fingers in the middle of the cricoid cartilage and then slide your fingers laterally on to the right or the left. Feel for the carotid pulse. If you don't feel the pulse, look for the assessment of breathing. He is not breathing, he is not responding, no pulse. Patient is not conscious, unresponsive. So he is in cardiac arrest. So you need to start the compressions immediately. Ask somebody to get help or a dial for the emergency medical team, and then you can start the compressions until somebody arrives. Yeah. Anybody who want to practice on-hand training can come over here and then we can practice. Yeah, earlier that was a thing now. So if you are willing, you can give a mouth-to-mouth respiration after 30 compressions. You can give a mouth-to-mouth respiration. But nowadays, most of them, they doesn't hesitate, but some give. Some doesn't hesitate, they give the mouth-to-mouth respiration. That can be given also.
Does it improve the chance of the person reviving? Or, does it improve the chance of revive, or is it just...
No, it improves usually survive. Even chest compression out of the hospital scenario improves the 2 to 3 times. Yeah, breath also increases. That will increase the chances of 2 to 3 times chances of survival.
Is it optional because he hasn't given the optional?
It's optional because hands-on is only on compressions. So once the medical team arrives, so they have their mask or ventilation things, they will take over the just compressions and the ventilation both. So until they come, it's only a first aid or a life-saving emergency procedure, a chest compression. Yeah, sure. Yeah. Anybody have any doubts you can ask about any cardiac arrest or anything? See, cardiac arrest can happen anywhere. Anywhere, in any situation it can happen. It can happen in shopping malls, in the parks, in schools, in outside public places, anywhere. It is usually unpredictable. Even we have seen young persons who are walking at the age of 16 and 22 also collapsing, and we have revived them. Yeah. So one more point is that whenever you are giving a compression, the below the surface should be very hard. If a patient collapses on a cushion or on a bed, take him down, put him on the floor or a hard surface, or if you have any board or anything wooden board, you can keep it behind the patient so that your chest compressions are effective. Your compressions are effective against the hard surface, and that improves more chance of survival. See, here what you are emphasizing is whenever you are placing your hand on the chest wall, your shoulders, your elbows shouldn't bend here. Otherwise, the force won't be transmitted to the heart. So it should be very straight, and the fulcrum should be acting on the elbow and the shoulder joint, so that your entire body weight is transmitted to the heart, and that improves more pumping affection. So it should be done, you have to count. You have to count it 1, 2, 3 like that, like you have to count it until 30. 30. Or for 1 minute, like now we are doing hands-on CPR with no ventilation. So you can do it continuously for 100 to 120 times. Anybody who want to get trained on, you can come over here. Sir, mic. Now, usually when there is 30 chest compressions, there will be 2 mouth-to-mouth respiration outside. And we give 30 compressions, we give 2 ventilations through the mask and ambu bag. But since this is a public scenario, out of hospital, you won't be having a mask or anything. So 30 compressions, you can give a mouth-to-mouth respiration. And after that, again start the cycle. 30 compressions, 2 ventilation, mouth-to-mouth respiration. It goes like that. Till the emergency medical team comes. Yeah. Usually we do that at 30 into 2 ratios for 5 cycles. And 5 cycles or 2 minutes we do that one. And after that 5 cycles, we check for the pulse. Sometimes the pulse may be felt and the patient can become conscious. So in that case, we can stop the chest compression. If the pulse is not felt, if the patient is not responding, so you can continue with the same 30:2 ratios. Anyone who want to get strained, please. Your chest compression should be at least 2 inches or 5 centimeters. Yeah. No problem. Anyone?
Why compression is important? This is why you want compression. This all is only out of hospital scenario. It's not in the hospital. Hospital scenario we need you to take this necessary. But suppose now outside you saw somebody is having this cardiac arrest. So compression is important. One thing is there because you
Anyone else who want to?
നമ്മുടെ ഡോക്ടറാണ്, അതൊരു കാർഡിയോളജിസ്റ്റ് ശില്പിയാണ്. 2 days back she joined in Sohar hospital. അതൊന്ന് പറഞ്ഞു. People will not believe it.
Okay. Thank you, Dr. Shilpa. Please come forward. You can have a hands-on training at least once here. ಟಿಶ್ಯೂ ಪೇಪರ್ ಇರ್ಕಾ ಇಲ್ಲ வெள்ளம் இருக்கு ಟಿಶ್ಯೂ ಪೇಪರ್ ಇರ್ಕಾ സർ ബ്യൂട്ടിഫുൾ പ്രസൻറ്റേഷൻ ഇല്ല ഇത് മൈക്ക് ഓണിലുണ്ടല്ലോ അതുകൊണ്ടാണ് ഓഫാ ಇಲ್ಲ ನಮ್ಮ ಸುದೇಶ್ ಬ್ರೋ ಟೇಕ್ ಓವರ್ ಇರ್ತೀನಿ
സജീവായിക്ക് ഡൗട്ടൊന്ന് ചോദിക്കാമോ
ഓക്കെ
യൂണിവേഴ്സിറ്റി കഴിഞ്ഞാൽ കണ്ടുവരും
അത് ഡോക്ടർ ശില്പാണ് പുതിയ കാർഡിയോളജിസ്റ്റ് സോഹർ ഹോസ്പിറ്റൽ അത് ടീം ഇപ്പോഴല്ലേ വന്ന് ജോയിൻ ചെയ്തത് കാറ്റലാബ് ഒക്കെ ഉണ്ടല്ലോ ടീം ഇപ്പോഴാണ് റീസെൻ്റ് ഇപ്പോൾ കാറ്റലാബ് ആയില്ലേ ഇപ്പോൾ ഡോക്ടർ അവിനാഷ് പഴയ കൊല്ലമായില്ല പ്രാക്ടീസ് ഒക്കെ ആളുണ്ട് പക്ഷേ പ്രാക്ടീസ് ചെയ്തില്ലല്ലോ ഇൻ്റർവെൻഷൻ ഇല്ലല്ലോ പണി കഴിഞ്ഞിട്ട് ഓർവല്ലായി Good evening.
Doctor, when a person collapses, how do you come to know that whether this is because of attack? It can be other reasons like
Exactly.
sugar or any other reason. How do you immediately come to know that whether it is because of attack?
See, cardiac arrest is where like your heart is not pumping, thereby there is no pulse at all. So for example, you are saying that low glucose. So glucose, the heart doesn't stop, it still pumps and you can feel the pulse. Still patient, very low glucose hypoglycemia, patient will be unconscious, not unresponsive, unconscious, but still you can feel the pulse. So cardiac arrest is where patient is unresponsive, he doesn't respond. No need to give a chest compression. I mean heart attack and cardiac arrest. See, as what I told you, like heart attack is circulatory problem, where there is a block in your coronary arteries, the arteries which supplies the heart itself. Whereas cardiac arrest is an electrical phenomenon as a complication of the occurring heart attack. And there are other reasons for cardiac arrest also. Heart attack is one of the reasons. So other reasons also are there where the patient can go into cardiac arrest. For example, somebody who is having a severe breathing difficulty for a long time, oxygen level decreases, hypoxia. So because of prolonged hypoxia also, patient can go into cardiac arrest. But that is not because of the heart attack. It's because of the very low oxygen level which persists for many hours and then the heart stops beating. Because it doesn't get the oxygen properly, it stops beating. So heart attack is one of the reasons for cardiac arrest. This is circulatory problem where there is a block. Cardiac arrest is an electrical problem. So, thank you.
Thank you, Dr. Prabhal, for giving us the time. Like CPR demonstration. Now, we are coming to the end of this both the programs. I think this session, both the sessions was very helpful and we were able to gather a lot of information by which we can, plan our future life. Now, I invite Mr. Sunil Kumar, Vice President of Sohar Malayali Sangam, to give a word of thanks.
Good evening. Please take your seat. In fact, we expect 200 to 300 people over here for this medical camping. But unfortunately, it is very less. I think people are well aware about health, that's why they don't care about this camping. That means, oh, we don't care about any camping, we are well aware about health. We don't have time. But we have time and money to come to the hospital and set as a patient. That will we do. Actually, I thought there will be a lot of people over here. Why people are thinking like this? Health is, they doesn't care about health. Health is the most welcome a human. While there is a sounded body, there is a sounded mind. Where there is a sounded healthy body, there is a sounded mind.
ആരോഗ്യമുള്ള ഒരു ശരീരത്തിൽ ആരോഗ്യമുള്ള ഒരു മനസ്സുണ്ടാകൂ. ആരോഗ്യമുള്ള മനസ്സിൽ മാത്രമേ ആരോഗ്യമുള്ള ചിന്തകളുണ്ടാകൂ. ഈ ആരോഗ്യമുള്ള ചിന്തകൾ മാത്രമാണ് ആ വ്യക്തിക്കും ആ വ്യക്തി ഉൾക്കൊള്ളുന്ന സമൂഹത്തിനും ആ രാജ്യത്തിനും പുരോഗതിക്ക് കാരണമാകുന്നത്. ചുരുക്കി പറഞ്ഞാൽ ഒരു രാജ്യത്തിൻ്റെ അടിസ്ഥാന പുരോഗതി ആ രാജ്യത്തിലെ വ്യക്തികളുടെ ആരോഗ്യമാണ്. അൺഫോർച്ചുനേറ്റ്ലി, നിർഭാഗ്യവശാൽ നമ്മുടെ ഭാരതീയർ ആരോഗ്യത്തെക്കുറിച്ച് ശ്രദ്ധിക്കാറേയില്ല. ഇവിടെ ഇരിക്കുന്നവരിൽ എത്ര പേരുണ്ട് 2.5 മുതൽ 3 ലിറ്റർ വെള്ളം കുടിക്കുന്ന എത്ര ആൾക്കാരുണ്ട്? സോറി, നോ, ഐ കനോട്ട് ബിലീവ്. യു ആർ നിങ്ങൾ അളന്നിട്ടാണോ വെള്ളം കുടിക്കുന്നത്? അൻ എക്സാമ്പിൾ, ഇപ്പം 150 gram, okay? I will use 10 times, so I will believe that, oh, I have to take a lot of water. You didn't reach even 1 liter. It's not enough. അനാവശ്യമായ ഫുഡുകൾ, അതായത് നമ്മുടെ രുചി എന്ന് പറഞ്ഞ സെൻസിനെ ഉണർത്താൻ വേണ്ടി അനാവശ്യമായ ഫുഡുകൾ കഴിച്ച് ശരീരത്തിന് ആവശ്യമില്ലാത്ത ലവണങ്ങൾ ശരീരത്തിൽ കൂട്ടിവെച്ചിട്ട് ബോഡിയിൽ നമ്മുടെ ശരീരത്തിൻ്റെ ഓർഗൻസിന് പ്രവർത്തിക്കാൻ പറ്റാത്ത സ്റ്റേജിലെത്തിയിട്ട് അവസാനം കരഞ്ഞിട്ട് കാര്യമില്ല. നമ്മളുടെ ഭക്ഷണ രീതി തന്നെയാണ് തീർച്ചയായിട്ടും നമ്മുടെ ആരോഗ്യത്തിൻ്റെ പ്രശ്നം. ഇവിടെ ഡോക്ടർമാർ വിശദീകരിച്ചതുപോലെ തന്നെ ക്യാൻസർ, കാർഡിയാക് അറസ്റ്റ്, ഇതിൽ നിന്ന് നമ്മൾ എങ്ങനെ മാറി നിൽക്കുന്നതിനെ കുറിച്ച് ആരെങ്കിലും ചിന്തിക്കാറുണ്ടോ? നമ്മുടെ ശരീരത്തിൽ അടിഞ്ഞുകൂടുന്ന അനാവശ്യ ലവണങ്ങൾ പുറന്തള്ളാൻ വേണ്ടി 2 മാർഗ്ഗമേ ഉള്ളൂ. 1, ആവശ്യത്തിന് വെള്ളം കുടിക്കുക. 2, ആവശ്യത്തിന് എക്സസൈസ് ചെയ്യുക. ഇതാരും ചെയ്യാറില്ല. എനിവേ, ആരോഗ്യമുള്ള ഒരു തലമുറ ഉണ്ടാകട്ടെ. ഒരു കാര്യം പറയാൻ മറന്നു കേട്ടോ. ഇപ്പം കേട്ടോണ്ടിരിക്കുന്ന നിങ്ങൾ വിചാരിക്കും, സുനിൽ പറഞ്ഞല്ലേ എന്നാൽ 2.5 ലിറ്റർ വെള്ളം അല്ലെ 3 ലിറ്റർ വെള്ളം കുടിക്കാമെന്ന്. വീട്ടിൽ ചെന്നിട്ട് വിചാരിക്കുക പിന്നെ 5 ലിറ്റർ കഴിച്ചാൽ എന്താണ്? ഓവർ കൺസ്യൂം ഈസ് എ വെരി ഡേഞ്ചർ, ഈവൻ ഇഫ് ഇറ്റ് ഈസ് അമൃത്. അൻ എക്സാമ്പിൾ, നിങ്ങൾ ഒരു 5 ലിറ്റർ വെള്ളം അറ്റ് എ ടൈം കഴിച്ചാൽ ഓൺ സ്പോട്ടിൽ ആൾ വടിയാവും. അതുപോലെ നിങ്ങൾ 2.5-3 ലിറ്റർ വെള്ളത്തിൽ കൂടുതൽ ഒരു ദിവസം കഴിച്ചു കഴിഞ്ഞാലും 1 വർഷത്തിനുള്ളിൽ വടിയാവും. അൻ എക്സാമ്പിൾ ഐ വിൽ ടെൽ യു. ബ്രൂസ്ലി അറിഞ്ഞൂടാത്ത എത്ര പേരുണ്ട്? ഐ ആം സോറി, ബ്രൂസ്ലി അറിഞ്ഞൂടാത്തവരും കൈപൊക്കിയേ. ബ്രൂസ്ലി, ദ ലെജൻഡ് ഓഫ് മാർഷൽ ആർട്സ്. പാവപ്പെട്ടവൻ 32ാമത്തെ വയസ്സിൽ മരിച്ചുപോയി. ആരോഗ്യ ദൃഢഗാത്രം, ഉരുക്കു മനുഷ്യൻ, ഹെൽത്ത് ഇതുപോലെ കെയർ ചെയ്യുന്ന ഒരാളില്ലായിരുന്നു. എന്തുകൊണ്ടാണ് അദ്ദേഹം 32ാമത്തെ വയസ്സിൽ മരിച്ചുപോയത്? ജസ്റ്റ് കൺസ്യൂമിങ് എക്സസ് വാട്ടർ. ഹി വാസ് യൂസിങ് എക്സസ് വാട്ടർ. അദ്ദേഹത്തിൻ്റെ ശരീരത്തിൽ ആവശ്യമുള്ള ലവണങ്ങൾ നിലനിർത്തുവാൻ അവസരം കൊടുക്കാതെ ഓവർ കൺസ്യൂം ഓഫ് വാട്ടർ അദ്ദേഹത്തിൻ്റെ ശരീരത്തിലെ ലവണങ്ങൾ നഷ്ടപ്പെട്ടു പോയിട്ട് തലച്ചോറിൽ സെറിബ്രൽ എഡിമ ഉണ്ടായിട്ടാണ് അദ്ദേഹം മരിക്കുന്നത്. ഞാൻ പറയുന്ന പോലെ ഒരു കേൾക്കുന്നുണ്ടോ ആവോ? സോ ഡിയർ ഫ്രണ്ട്സ്, എല്ലാ ദിവസവും ഒരു 2 ലിറ്റർ വെള്ളം കുടിക്കാൻ ശ്രമിക്കുക. അത്യാവശ്യം എക്സസൈസ് ശ്രമിക്കുക. 90% ക്യാൻസർ ഉണ്ടാവില്ലെന്ന് ഞാൻ ഗ്യാരണ്ടി തരാം. 90% കാർഡിയാക് അറസ്റ്റ് ഉണ്ടാവുന്നില്ല ഞാൻ ഗ്യാരണ്ടി തരാം. ഇത്രയൊക്കെ ചെയ്തുകൂടായോ അറ്റ്ലീസ്റ്റ്? എനിവേ, താങ്ക് യു. The responsibility entrusts on me to express our gratitude to all stakeholders to make the medical campaign huge success. First and foremost, I would like to thanks to Doctors Bose Vincent and Dr. Jayaprabhavan, and really thanks to the audience. Unfortunately, audience are very less. But it's enough. And our thanks is, sincere thanks is to go to Lulu Group. They have given the venue to take the medical campaign success. I'm really thanks to Badar Samaa Group, especially our president. And our SMS brothers and sisters, children's, I'm giving my sincere thanks to all. Anyway, thanks once again. Good night.